meantime, Tonya can set the audio. I just unmuted you. Don James, with your phone, can you hear me?
This is Tanya.
Oh, Tonya, we can hear you now. That's good.
Oh, great. I had to change the microphone. It's selected for my apologies.
It's okay. There's a bit of delay, and sometimes putting the video, it takes a lot of internet broadband. So if that, we prefer to hear you well. So if you want at a certain moment to remove the camera, that will be okay. I just wanted to make sure that you can see the English screen, the English presentation. And so it's at the top of your screen. You may see view options, or on the right, top right, there is something saying screen share in parentheses 2. And then if you click on it, you should be able to select presentation in English or presentación en español.
Oh, yes, I do.
You don't see it?
English. For the language interpretation?
So the interpretation is for you to hear in English or in Spanish, but for the screen, you have view option at the top of your screen, or because there is a new change with Zoom, or you can have it on the side and it says screen share, and it's a button that may appear when you hover over the left top side of your screen, and it says screen share in parentheses 2.
Right.
And when you click on it, you have the option to select the screen. Can you see that?
Oh, I'm sorry. For the
I can barely understand what you say. There's a lot of
hide captions. Let me unmute my keys for better connection.
I have difficulties understanding what you say, Tanya. Yeah. Okay, we will go back to Tanya in a minute. We are almost on. Well, we are on time. I will just double check with Don James if we can check on Don James, please. I could see you a bit. Where are you, Don? I think we lost Don. Oh no, here you are. I can't hear you. I know you're in the room, but I can't hear you. So I'm Don, I'm admitting you with your phone call again. Let's check if it works. Don, can you hear me? To unmute on the phone, Don, I think it's *6, isn't it, Marina? Yeah, *6.
Can you hear me?
Yes, now I can hear you on the phone. Yes. Yeah. Perfect.
I'm having a lot of difficulty.
Yeah, it's okay, no problem. So if you can hear us anytime, we can keep the phone. I will mute your phone, and whenever you want to say something, we can unmute the phone for you.
I'll raise my hand.
Yeah, you raise your hand. You have the chat. You have all of this. Yeah, perfect. Can you see them at the screen in English?
Yes.
Perfect. Okay. So and you're in English here, so I will mute your phone now. And your screen, just in case it works again. And we'll start the meeting in a minute. I just want to confirm with Silverio that he can hear the meeting. And I will work with Tonya.
I can hear you.
Yeah,
Perfect. Thank you, because we're on time.
So Carolyn, we have Rob in the waiting room.
Okay, we also
just
have
joined us.
Rob. Yeah,
Mhm.
perfect. So I will admit Rob, and then I will double check with Silverio. Good morning, Rob. I just unmuted you. I don't know if you can hear me, Rob. Rob, good morning. I don't know if you can hear me. I can see your picture. Rob, can you hear me? We would like to make sure you can hear us and see the proper presentation on your screen. And Rob, can you hear me? Okay, we're on time, so I think we will start the meeting. At any moment, Rob and Tanya, I know you have some technical difficulties. If you can hear us, that is already good. You can hear me, Tanya. Thank you for the thumb up.
Carolina,
Yes.
if I may,
Yes,
Michael
of course.
here. Maybe Mary, are they punched into the Wi-Fi audio?
Oh, yeah,
Thank you.
thank you. Thank you for this. Yeah. So when you join via Wi-Fi audio, that works better. And so we will start the meeting because we're at 10:05 and I don't want to use more of your time. And whoever is having technical difficulties, you can always chat. So we have a meeting chat. And you can also send me an email or anything and we will make this work. I will. So I will hand it over to you, Marina. I think we are all set.
Yeah. One quick reminder, what about are we going to take a group picture?
I'd like to, and we have Edwin arriving. We can take that picture. We will need to have everyone putting their screen on.
Unless we want to hold off until after lunch or before lunch, however you want to do that.
I'm fresher right now, but after lunch, I think I will look better now, but I will take pictures at certain times just in case.
So I just wanted to remind folks that per the legal requirement under Bagley-King, it's necessary for all advisory group members to turn their videos on during the course of the meeting. So that's a quick reminder. Thank you.
Okay, so whenever I can see all of you in my screen, I will take a picture. And good morning, Edwin. I know you just joined us. Just wanted to make sure that you can hear us.
Yep, everything's good to go, Maya.
Perfect. And you have the right screen and everything?
Yep.
Perfect. Thank you. So I can see everyone. Yeah, most of you. Okay. My screen is so
Caroline.
Yes, who's speaking?
Soy Isabel.
Sí.
¿Ya están en el cuarto de interpretación?
Así es.
Porque
entonces,
no me está mandando, te estoy oyendo en inglés.
Ok, entonces abajo de la pantalla debería aparecer
Sí,
o spam. ¿Ya lo tiene?
Ya entré ahí, pero de todos modos te escucho en español.
¿Sabe qué, señora Isabel? Disculpe, aquí la marco. Parece que mi colega tal vez se le olvidó prender el micrófono. Ahorita le mando un mensaje para recordarle, ¿ok?
Va.
Ok, muchas gracias.
A usted, gracias por mencionarlo.
Gracias. Y ahora tenemos también a Mark en la sala principal porque Mark nos va a dar el anuncio en español en el canal en inglés. Entonces, if you're listening in English and you will hear Mark speaking Spanish, that's totally normal at first because he will give us some explanation on how to hear the meeting in Spanish, okay?
Señora Isabel, si sigue teniendo problemas con el canal, por favor, avísenos.
Ujú.
Marina,
Gracias.
y
Sí.
algo que quiero recordarles, tengo cirugía de un ojo. Voy a aprender nada más cuando abra la junta y voy a apagar la cámara porque la luz me afecta la vista.
Está bien.
Ujú.
Gracias.
Ok,
Sí,
por
cómo no,
favor.
gracias. Ajá, sí, cómo no,
Gracias.
señora. Gracias.
Okay, so I will take a picture for those who are on the videos. Okay, so it's a screenshot. It's not very professional, but give you your best smile. We get this. Thank you so much. Yay! Okay, I press print screen. Okay, now I'm doing it. Perfect. Thank you for this, and I will take other pictures during the day. Maybe without.
Okay.
Have a good one. Over to you, Maria.
Yeah, so one more thing. There's one more person in the waiting room. That's Rob Burrows. So let me know, Caroline, if you want me to go ahead and get started, or do you want to wait until we admit Rob?
I was muted. I wanted to stop talking, but I just unmuted Rob, so we can double check really quick with Rob if he can hear us. Good morning, Rob. Can you hear us today? Oh, he's connecting to audio. And just to let you know, the picture was good.
Awesome. Good to hear.
Yes, I love it. I'm just saving it before I forget. So Rob, I can see you're still connecting to the audio. So can you hear us, Rob? And if you have some technical difficulties, maybe you can go, there's a reaction button, and at least if you can put a thumb up or something like that, if you can hear us. You can also chat. We have a meeting chat today. So I will show you, oh no, I'm sharing in Spanish only, but we have a meeting chat and you can always send us a message. I see you.
Can you hear me now?
Yeah, we can hear you. Thank you. Good
Perfect.
morning, Rob.
You're welcome. Sorry.
No, it's okay. Just
Okay.
to let you know, there was some change on Zoom. So can you see the screen in English? There's a presentation
Yes,
in
I can.
English. Perfect. So that's good.
All right.
Perfect. Thank you so much, Rob.
You're welcome.
Over to you, Marina.
Thank you, Caroline, and thank you everybody for their patience. Again, technology never ceases to amaze us or surprise us. So thanks everybody for your patience as we work through that. Good morning and thank you for joining us. This meeting is being webcast publicly in both English and Spanish at video.calipa.ca.gov. This meeting will be recorded and posted on our website. For those of you watching, there is an English and Spanish webcast at video.calipa.ca.gov. To provide comments during this meeting, please email them to safer@waterboards.ca.gov. If you prefer to provide your comment verbally, let us know and we will provide instructions for you to join the meeting. As a reminder, interpretation services are being provided for this meeting in both English and Spanish, and we will share those instructions shortly. Next slide, please. Good morning and welcome to the Safer Advisory Group meeting number 2. My name is Marina Perez. I'm a program manager with the Office of Public Participation. It's great to see and hear all of you again today. We have a lot of really great information to share with you, and we're looking forward to hearing your feedback as well as any questions you may have. Next slide, please. Okay, so now we're going to go over some meeting logistics. Next slide, please. So for this, I'm going to actually use this time to introduce our interpreters, Mark and Andres. Mark, can you please provide the instructions, walk folks through the instructions for the language interpretation thing, please?
Will do. Thank you, Marina.
Yeah.
We'll provide them in both English and Spanish for those who need it. Por favor, aquellos que nos acompañan en español, bueno, primero, buenos días. Sepan que tenemos interpretación disponible para la sesión del día de hoy. Para escuchar el programa en español, seleccione el icono de un globo en la parte inferior de su pantalla que dice Interpretation o Interpretación. Luego seleccione su idioma Spanish o español y de ahí podrá escuchar todo el programa en su idioma. And for those listening in English, please note to listen to any comments or questions given in Spanish. You can also select the globe icon at the bottom of your screen that says interpretation, and then select your language English so that you can hear a live rendering of that comment. You can also choose in which language you'd like to view the PowerPoint presentation. Please scroll to the top of your screen and select the button that says View Options. You can then select in English or Spanish. Y para aquellos de habla español, claro, pueden elegir el idioma en que desea ver la presentación. Vaya a la parte superior de su pantalla, seleccione el botón que dice View Options, luego seleccione Shared Screens, y de ahí puede seleccionar presentación en español para verlo en su idioma. Muchísimas gracias. Thank you, Marina. Back to
Thank you, Mark. Yes, could we please advance the slide? Yeah, so this is the information that Mark was sharing with you. So again, I don't know, Mark, if you want to have any additional comments, but this is the information he was sharing.
My apologies if I got
Yeah,
ahead without
that's
seeing the
okay.
slide.
That's okay.
Disculpe, sí, aquí
Yeah.
entonces la pantalla donde se puede ver la opción para seleccionar su idioma para ver la presentación, las diapositivas en español. De una vez más, View Options en la parte superior de la pantalla, Shared Screen, como puede ver aquí, y luego presentación en español. Thank you, Marina.
Gracias. Thank you, Mark. All right. Okay, next slide, please. Okay, so in terms of ways to participate, the meeting is being recorded and webcast publicly in English and in Spanish at video.calipa.ca.gov. Again, the recording will be posted on our website. For webcast viewers, there are separate streams in English and Spanish, again at video.calipa.ca.gov. To provide comments during the course of this meeting, again, please email them to safer@waterboards.ca.gov. We look forward to your comments. Next slide, please. The mission of the state of water boards is to preserve, enhance, and restore California's water resources for the benefit of present and future generations. We start this meeting by acknowledging the groups who have experienced economic, environmental, and social disadvantages as a result of historical marginalization, racism, and injustice. The Safe and Affordable Funding for Equity and Resilience Drinking Water Program, known as the SAFER program, was created to bring environmental justice to California. Additionally, the SAFER Advisory Group was established to provide the State Water Board with constructive advice and feedback on the Safe and Affordable Drinking Water Fund expenditure plan and other related policies and analyses. The group is composed of approximately 20 appointed members that represent public water systems, technical assistance providers, local agencies, non-governmental organizations, the public, and residents served by community water systems in disadvantaged communities, state small water systems, and domestic wells. The group meets up to 4 times a year to provide many opportunities for public and community input. As a reminder, our work today should strengthen the empowerment of Indigenous and community voices as we work together to provide safe and affordable water to all Californians. Next slide, please. Today's presentation, today's agenda includes 2 presentations and a discussion in a large group. Before lunch, the Division of Drinking Water will present the results of the needs assessment for 2024, followed by the Division of Financial Assistance, who will present on the draft fund expenditure plan. The afternoon session will include a large group discussion where we will have an interactive exercise using Microsoft Forms to receive your feedback on the draft expenditure plan for fiscal year 2024-2025. The last part of the session will include SAFER program updates and next steps, as well as public comment. Please note, we will have short breaks throughout the meeting and a lunch break throughout the day and during the day. However, if need be, you can step away as needed. Please let us know if you need to step away for a longer period of time. Next slide, please. Okay. To ensure we cover our entire agenda, we would like to share the following meeting guidelines for today's session. As a reminder, please keep your cameras on during the entire meeting. Please mute yourself when you're not speaking and join by video, and remember to have an appropriate background as we are being live streamed. We ask that you speak slowly so that the interpreters can accurately capture everyone's words. Andres and Mark, our interpreters, will be providing simultaneous interpretation in Spanish and English. Please remember to speak slowly to ensure the interpreters can capture all of your feedback. If a presenter or advisory group member is speaking too fast, we will ask you to slow down so that Andres and Mark can accurately capture your comment or question. Also, during the question and answer portions of the meeting, please use the raised hand feature if you have a question or comment. When asking a question or comment, we ask that you keep it as short as possible, to the point, in order for to allow others to participate. Also, if you're asking questions, also use the raise hand feature. Additionally, we know that we have a lot of questions. We gather, on a quarterly basis. We may want to discuss about, other items. We ask you to please limit your discussions specifically to the agenda items. Additionally, we ask you to be fully present and participate fully. So the other piece here, the last piece, is we ask that you please have the meeting materials that were sent to you a few days ago on hand, as we will be referring to them throughout the course of the day. If disconnected, please rejoin as quickly as you can. If you're having some technical issues, again, please contact us and we will provide some support. Next slide, please. Okay, so now we're gonna kick this off with a warmer. So we want we want to hear from you. We want to take this time to warm up the group with a round of 20-second introductions. When I call your name, please turn on your microphone, share your name, the name of your affiliation or group that you represent, your location, and in a few words, let us know what are your plans for the Memorial Day weekend. So again, keeping it very short to about 20 seconds. And I will go first as an example. Okay, so my name is Marina. I'm with the State Water Board's Office of Public Participation in Sacramento. I'm your meeting facilitator. And for the Memorial Day weekend, I plan to go hiking. So that's an example of the introduction. So as a reminder, please turn on your camera, unmute yourself when speaking. Remember to unmute yourself when you're not speaking, and keep your introduction brief to 20 seconds maximum. So we're going to go ahead and start with Tonya, followed. Let's start off with Tonya, and then we'll popcorn to the two other folks. Tonya. Tonya, we can't hear you. Okay. So let's move on to Stephanie. We'll come back to Tonya.
Thanks. I'm Stephanie Anagnason.
Yeah.
I work for Madera County, and I'm in the city of Madera now. And I have not got far enough to think about Memorial Day plans, but I look forward to hearing others' responses and maybe getting some ideas. Thank you.
All right. Thanks, Stephanie. Thanks for joining. All right, we'll move on to Soren.
Yeah, good morning, everybody. Soren Nelson with the Association of California Water Agencies. I'm here in Sacramento, and I'm going camping on the Cosumnes River.
That sounds awesome. Thanks, Soren. Okay, so we'll go to Silverio. It looks like we're having some issues with Silverio, so we'll go ahead and move on to Shannon, followed by Sarah. Shannon? Shannon is stepped away for a second, so let's move on to Sarah. Sarah's not here, sorry. Rob.
Can you hear me?
Yes.
Okay,
Yes.
Rob Burrows.
Thanks, Rob. Yeah.
Cottonwood, California. I was just elected as District 1 Supervisor for Tehama County. And for my Memorial Day, I am a combat veteran. And so I'll be speaking at 2 different cemeteries in honor of our veterans.
Thank you, Rob, and thank you for your service.
You're welcome.
Yeah, and congratulations.
Thank you.
All right, so let's move on to Rami and followed by Michael Prado Sr.
Good morning, everyone. This is Rami Kalon. I'm with California Water Service. I'm based in San Francisco, and so far I have no plans for Memorial Day. Thank you, everyone.
All right, thank you, Rami. Mr. Michael Prado Sr.
Michael Prado Sr. I'm with the Santana Community Services District, also the Alma Coalition, and several others. My location is Santana, California, in the central San Joaquin Valley. And I'm looking forward to eating on Labor Day, and I don't care where. Thank you.
Thank you. Okay, we're gonna move on to let's go with Kristen Dobbins.
Hi, everyone. Good morning. Kristen Dobbin with UC Berkeley and UC Agriculture and Natural Resources. I am in Sacramento, and I, like Stephanie, have not even thought towards the end of the month. I just got back from vacation, so I will probably not be doing much.
Okay. And that's okay, right? That's what holidays are for. So that's cool. Thanks, Kristen. Okay, let's call up James. Jim.
Yeah, hi, morning. My name is Jim Sullivan, and I represent private well owners across the state. And I live in the town of Mendocino in Mendocino County. And yeah, I was kind of a shock to my system to even start thinking about Memorial Day. So yeah, we'll see. Probably stay home.
That's all good. That's all
Yeah.
good. Yeah, it's about rest, right? It's about self-care.
Yeah,
All
exactly.
right. Thanks, Jim.
Yeah.
Okay, so let's transition over to Chelsea.
Good morning, everyone. It's nice to see everybody. My name is Chelsea. I'm with Monterey Waterkeeper here in the Central Coast. And I'm actually going on a road trip with my family to Yellowstone and that corner of the country. So there'll be a Memorial Week, I guess.
Yeah.
I'm really looking forward to it.
Thanks, Alice. That sounds very restful. Thank you, Chelsea. Okay, let's move on. Let's hear from Eric Orellana.
Thanks, Marina. So the only reason I've thought this far out is because Memorial Day weekend is my birthday. But
Hey.
let me back up. Sorry about that. I haven't even introduced myself. Hi, everyone. My name is Eric Orellana. I'm a senior policy advocate with the Community Water Center. We have 3 offices, but I'm currently working out of our Visalia office, so from the Central Valley. And then to get into the warmer, I'll be turning 25 this year, but I think probably what I'll be doing is having a carne asada or a barbecue over the weekend, and then calling my insurance to make sure the car insurance rate has gone down. Hopefully, yeah.
That all sounds good, and happy birthday in advance, Eric. Great. Okay, now we'll ask Eva Dominguez.
Hi, everyone. My name is Eva Dominguez. I'm a technical assistance provider with Self-Help Enterprises. I'm in Dinuba in Tulare County. And I also do not yet have any exact plans, but we might have some family coming from Orange County.
That's great. Thanks, Eva. Okay, we're going to go back to Tonya. Tonya, are you on? Okay, we'll get back to you. Okay, let's go to Don James.
Are you hearing me?
Tonya, if you're speaking, I can't hear you. But Don, if you could go ahead and go next, please.
Hello, my name is Don James. My affiliation is Hollow-Dini Nation, a small tribe here in Central California. My plans for Memorial Day are to be camping with my family.
That's awesome. Yeah. Sounds like we're going to have a lot of our members up enjoying the outdoors. That's great. Okay, so I know we're having a few technical difficulties, and we're trying our best to work through them. So we're going to try to get back to you, Tonya. But now I want to ask Isabel if she can share her plans for the Memorial Weekend.
Hola, buenos días. Mi nombre es Isabel Solorio y soy la voz de mi comunidad Lanare. Estoy ubicada aquí en Lanare, California, en el condado de Fresno. ¿Cuáles serían mis planes para el fin de semana, feriado, o sea, de memoria? Pasar con la familia y pues descansar un poco porque hay que cuidarnos. Gracias.
Gracias, señora. Okay, can we also ask Edwin to go next?
There it is. Yeah, Edwin, I'm a member of the public. I don't have plans other than turn off my phone. Hopefully the city doesn't call.
Yeah.
But other than that, yeah, I'm good.
That sounds like a restful day, turning all your electronic devices off. Okay. Very good. Okay, so we still have I'm not sure, Rob, I'm not sure, Rob, did we, can you go next, Rob?
Yes. No, I went already.
You ran away. Sorry, my list is off. My apologies.
That's okay.
But thank you. Let's go. Can we try Silverio again and then Tonya?
Sí, buenos días.
Buenos días.
¿Me escuchan?
Sí.
Mi nombre es Silverio Pérez. Estoy acá, pues estoy representando a mi comunidad del Royal Oak y estoy allí en la Royal Oak, estamos aquí en Royal Oak. Y pues yo creo que los planes son estar aquí con mi familia, aprovechar ese día de descanso y compartir ahí con mis hijos, mis nietos. Muchas gracias.
Qué bien, gracias, señor Pérez. Okay, let's try Tonya. Okay. All right. Tonya, can you go next, please? Tonya?
Are you able to hear me?
Yes. We can hear you.
Can you hear me?
Yes, we can hear you.
Tanya Moreno.
Yes, Tonya, we can hear you.
Are you able to hear me?
We can hear you, yes.
Oh, thank you, Lord. My name is Moreno, and I live in LeGrand. I'm a resident and a community member. And Memorial Day, a community day here in LeGrand, and I will be part of the parade, coaching a biking club and a color guard unit.
Wow. Wow, that sounds fun. Thank you, Tonya. Thanks for sharing. All right. So did I miss anybody? I think okay, looks like we have everybody covered. Thanks for sharing all those introductions, and it looks like you all are having a good time, planning for a good time for the weekend. So good to hear that. Okay, so now we'll move on to we'll move on to the next portion of our presentation. Actually, we're going to kick off with our presentations and introduce the team. So next slide, please. Okay. So now I'd like to kick off the series of presentations by introducing Kristen Abhold from the Division of Drinking Water. We ask that you please refer to the meeting materials packet on page 2. Next slide, please. Okay. Sorry. So
would you like me to
yes.
move forward?
Yeah, please. Yeah, thank you. Sorry.
All right.
Yeah.
No worries. Good morning, everyone. I'm Kristen Appold. I am the senior or the supervisor for the Needs Analysis Unit within the Division of Drinking Water. And I'm going to go over a bunch of data and information with you today. I apologize in advance if it's a little numbers heavy, but I'm hoping that you'll be able to get a sense of where we are in the state so that you can provide meaningful recommendations and insights to our Division of Financial Assistance on where we should be prioritizing our funding and our technical assistance here within the SAFER program. So today I'm going to go over our analysis, which we call the needs assessment. We're going to talk about failing water systems. We're going to talk about our systems that are considered at risk of failing. We're going to give you an update on some of our activities to try to put a price tag on how much it may cost the state to implement solutions. And then we're going to talk about drinking water affordability. Next slide, please. So what is the needs assessment? Why am I putting all this data in front of you today? Well, legislation was passed a number of years ago that requires us to develop this analysis on an annual basis. And it's supposed to be used to inform how we prioritize where we spend our money and how we dedicate staff time to water systems and communities across the state. Because we only have so much resources. How do we prioritize? Next slide. So what we do is we conduct the needs assessment, and then we share this information and data with you, SAFER Advisory Group. Then you all help provide some meaningful insights, recommendations on how we then should prioritize our funding and our technical assistance resources in the fund expenditure plan, which then helps drive where we do community engagement, which ultimately helps us achieve the human right to water across the state. So hopefully this gives you a sense of how this information is supposed to ultimately lead our program. As you can see right in the middle there, you all play a very valuable role. Next slide, please. So the needs assessment, which is a big data analysis effort, is composed of 4 core pieces of work. The first is we identify water systems that are considered failing water systems across the state. We then try to identify water systems and communities that are at risk of failing, because we want to be more proactive and try to keep them off our failing list if we can. We do a cost assessment to try to put a price tag on how much it might cost to achieve the human right to water across the state, so we have a sense of what the demand might be on our funding resources. And then we do an affordability assessment, trying to see if communities can afford some of the long-term solutions that we know need to be implemented in a lot of these communities. So it helps us better understand kind of where we are across the state for drinking water. Next slide, please. We are going to be releasing the 2024 analysis, hopefully later this month, but we have put out over the last 3 years, 3 iterations of the needs assessment. If you are a data nerd and you want to dive in, feel free to visit our website. We have lots of materials, we have dashboards, we have data that you can play with. It is all available online. Next slide, please. And I want to emphasize that all of the methodologies, how we get to the numbers that I'm going to be sharing with you soon, all of that has gone through a very rigorous public engagement process. Our methodologies were developed in partnership with our stakeholders like you all, so that we can do our work the best that we can. And we don't like to do anything within a black box. If you are hearing me talk about anything today and you have suggestions and recommendations on how we can do our work better, we want to hear from you. And we're going to continue to try to improve how we do this work. And your input is valuable. Next slide, please. All right, let's talk about our failing water systems. Next slide. So big picture, failing water systems are those that are continuously out of compliance or they're consistently out of compliance. They usually have one or more violations and open enforcement actions. It does not necessarily mean that unsafe water is being delivered to customers. In some cases that is occurring, but in other cases, there's kind of a technological failure, a managerial failure. So just wanted to make sure that we don't assume that all of these systems are delivering unsafe water, but they are considered kind of our worst offenders at the moment. Next slide, please. They are our top priority for the SAFER program. We try really hard to make sure that our program is really prioritizing failing water systems in those communities that they serve. Next slide, please. There are just under 900, or I'm sorry, 900. There's just under 400 failing public water systems across the state. We have a dashboard, and that hyperlink there will take you to the dashboard online where you can see the list of failing systems each day. It is refreshed every morning. We look at available violation and enforcement action data. If a system comes back into compliance or they're no longer meeting our criteria, they'll come off the list the next day. If you click on any of those dots, you'll see their profile page and you can see why they are failing and how long they've been failing for. Next slide, please. This is the criteria that we use to determine our failing water systems. It has evolved over time since we started tracking failing systems in 2017, kind of as our understanding of failing has evolved over time. In the beginning, we only looked at water quality violations, primary MCL or secondary contamination. In 21, we expanded that. We included E. coli violations, treatment technique violations, and multiple monitoring and reporting violations. So you have to have missed a lot of your water quality reporting to us in order to get on the failing list. One of the changes that we're making this year, and we're very proud of this, is that we're adding a new category of failing, which is source capacity and water outage violations. What we noticed during the last drought, just a few years ago, is that we had a lot of water systems that were running out of water. They had to rely on bottled water or hauled water to meet their customer demand. But we didn't have a way to get them on our failing list. They weren't technically meeting any of our failing criteria. And I think we would all agree that if a water system is out of water, that would be a big problem. So what we did is created new violation codes to allow us to track those systems. And so now we're going to be able to have them on the failing list and prioritize them for funding and technical assistance when they're on our list. Next slide, please. So for those of you who want to dig in and better understand, well, what violations are going to get a water system on the list, that's what we have here. So if a water system fails to have adequate source capacity, if they have inadequate capacity due to curtailments, if they have inappropriate or inadequate pressure within their system, these are all things that could lead to a system not being able to deliver water to their customers and would get them on our list. We just launched the new criteria today, and there are 18 water systems that have been added to our failing list for meeting this new criteria. Next slide, please. Okay, so that's our failing water system list. And like I said, it's just under 400 water systems that are failing. And we are doing a lot of work to try to help those communities come back into compliance and get them off that failing list. But part of the needs assessment is to identify systems that are at risk of failing. We want to be proactive in trying to provide assistance and guidance to water systems before they fail. We don't want to just be reactionary. And so the risk assessment helps us try to identify those systems and figure out what might be some challenges that they're facing right now or in the future. We look at both public water systems, which we regulate at the Water Board, but we also look at state smalls and domestic wells. We don't regulate those systems. If you're a private homeowner with a well, we don't go in there and require water quality testing of your well. But they are regulated at the county level, and each county does it a little differently. But we still do a risk assessment to try to get a sense of the scale of problems that might exist out there. Next slide. So again, we're really just trying to get a sense of where is there risk across the state? What does that risk look like? Can we develop programs, materials, target some technical assistance to try to keep systems and communities from failing? Next slide. So our risk assessment results help us fill in the rest of our priority pyramid, if you will, for the SAFER program. As you can see, failing systems are still at the top, but our at-risk water systems are our second highest priority, followed by potentially at risk and then not at risk, right? And so really trying to help us target where we focus our efforts under the SAFER program. Next slide, please. I'm not going to go into all this detail unless you want to, but we look at a lot of different metrics or data points around risk to try to identify our systems that we want to highlight as being, at risk of failing. The 4 categories that we look at are water quality risk, accessibility risk, affordability risk, and technical, managerial, financial capacity risk, which includes some of those financial indicators around a water system. We have not changed these indicators over the last 2 years, so our risk assessment methodology is the same. And we have lots of materials online if you want to learn more about these risk data points and where we get the data from and how we calculate them. Next slide. What we do is we have our risk indicator, a data point, if you will, and then we look at risk thresholds within that data point. So for example, if you have multiple treatment technique violations, the more violations you have, the higher your risk score is going to be for that indicator. We also have weights associated with them. So when we did public workshops developing our methodology, some folks felt like there are some metrics that we look at that should be weighted more than others because they are a higher indicator of risk. So that kind of helps explain how we look at some of our data. Next slide, please. So this is the results. We're starting to look at trends over time now that we've been doing this analysis for quite a bit. And you can see that most water systems across the state, are performing about the same from at least 2022 to 24. We made a lot of changes to how we conduct the risk assessment between 21 and 22. That's why you see those changes there. But for the most part, it's fairly flat. Our at-risk systems, though, we saw a bit more this year than we did last year. And one of the drivers of that is that one of our risk indicators, which is reliance on bottled water or hauled water, that's one of the risk indicators that's going to make you automatically at risk. And we started collecting data from water systems in 2023, asking them if they're relying on hauled water or bottled water. We'd never really collected that data before. We started doing that in 2023, and we identified about 100 systems that were reliant on bottled water and hauled water that we didn't know about before. And that's why we're seeing an uptick there in the number of at-risk systems in this year's analysis. But for the most part, everything else is staying about the same. The not assessed water systems are large community water systems and wholesalers. They are excluded from the risk assessment. They do serve the largest proportion of Californians across the state, but they are excluded from this analysis. Next slide, please. Okay, so that was the risk assessment for state smalls and, I'm sorry, for public water systems. We also look at our high-risk state smalls and domestic wells. We look at 3 different categories of risk. So we have water quality, water shortage, and socioeconomic risk. Next slide, please. We're seeing here somewhat similar trends for the number of high-risk state smalls. So here you can see the vast majority are scoring at medium risk, and then we have low risk, about 500, and then we've got high risk is that third, so just around 200 high-risk state small water systems, and then very few that are getting 0 risk points. You'll see that, again, that big shift in 2021 to 2022 is because we got new data and we changed our methodology. And this really helps highlight, again, why methodology is really important. It can really shift the results of the analysis. Next slide, please. For domestic wells, you can see we have a lot more of those included in our analysis in state smalls. It's in up to 180,000 on the left here. I think we actually have over 200,000 in the analysis, but again, most are low, medium risk, but we have around almost 80,000 high risk domestic wells, and then very few that have 0 risk associated with them. Next slide, please. Okay, so that is our risk assessment results, and we've talked about failing. So now that we have a picture of which water systems in the state are failing, which ones are at risk of failing, and what their challenges are, one of the things that we're required to do is to then try to put a price tag on how much it may cost to implement short-term and long-term solutions for these communities. You know, how much would it be to bring everybody into compliance and make sure everything's sustainable and we're achieving the human right to water? Next slide. I want to emphasize that we do this cost exercise just to help us with planning for the SAFER program. We don't use any of the analysis that we do to help inform local decision making or to inform anything that we do for funding decisions. It's really just an academic exercise to help us try to understand how much these things may cost for the state. Next slide. So the cost assessment model, so this is how we put a price tag on everything. It's fairly complicated. We've gone through 2 years of rebuilding our entire model from scratch. So there's a lot of work that's gone into this, and this infographic explains at a very high level what's being done here. The first is we take, like I said, all of our failing and at-risk systems, and then we narrow down what their challenges are to try to match up what the best short-term and long-term solutions might be for those communities. And then based on what the model chooses as those solutions, we then have to calculate cost estimates for all of those things. And then we aggregate all of the costs up statewide and for each water system, or state small and domestic well. Next slide, please. We've hosted many workshops on our cost assessment model over the last 2 years. And all of this information is posted online. So if this is an area that you are interested in, definitely dig into all of our materials. Next slide, please. I wanted to give you just a sense of what we're looking at here. We had to redo our cost model from what we had in 2021 because we've seen a lot of changes in how we identify failing and at-risk systems. So you can see hopefully the green text here. We expanded failing criteria. So we needed to have new long-term and interim solutions for criteria we hadn't had in the past. And for state smalls and domestic wells, we used to only look at locations that were high risk in water quality. But in the last few years, we added drought risk too. So then we needed to include new solutions in our model that would cover drought challenges. Next slide, please. So what do we look at? So for failing water systems, especially if they have water quality issues, we look at the feasibility in our model of a lot of different types of solutions. We look at physical consolidation. We look at centralized or decentralized treatment. We look at additional infrastructure that they may need, like additional storage or meters. We look at whether or not a new public supply well is needed. We look at potentially technical assistance and administrator assistance. So again, kind of trying to match up challenges to potential solutions. Next slide, please. For state smalls and domestic wells, these are obviously very small communities. We look at a smaller subset of potential solutions. So we look at whether or not those locations can be consolidated or hooked up to a nearby public water system. We look at decentralized treatment if we see high water quality risk. Some cases, we see water quality risk that is so high that treatment may not be viable. And so we do cost out long-term bottled water, which is that's our least favorite long-term solution in our model, but in some cases may be necessary. We do look at drilling new private wells, especially for those wells that are in drought risk areas. And we look at technical assistance as well. Next slide, please. So we've done quite a bit of research and outreach to try to update all of our cost assumptions within the model. This slide just kind of summarizes all of those activities, but it's been quite extensive, and all of our documentation has citations indicating where our data and cost assumptions came from. Next slide, please. And I wish I had more to share with you today. We are still going through the process of getting our analysis reviewed and approved, but we do have cost numbers coming soon. We did publish some preliminary cost estimates in December, which the total dollar amount was over $10 billion across the state. So our new numbers are very similar to what we had in December. But we should be publishing those soon and can share that with you once it's available. But wanted you to at least understand what we're working on before we give you those that data. All right, next slide, please. The next piece of analysis that we intend on doing once we have our cost assessment numbers finalized is we're going to do a funding gap analysis. Next slide. And what we're trying to do is understand how much money we have available at the Water Board and what the gap is between our cost estimate and our anticipated funding amount that we have. So this is kind of our methodology that we will be following. We take our estimated funding needs from the cost assessment. We take funding availability that we project having for the next 5 years. We then figure out what our funds can cover, and then we come up with a gap number. And this, again, helps us better understand how far our money can go. And it helps inform how we set our priorities for these different funding programs. Next slide. Like as before, it's coming soon. We're this close. Give us a few more weeks and we're hoping to get this information out to you. But we are anticipating a funding gap, both on the grant side and the loan side. But hopefully we'll have those numbers to you soon so you'll have a sense of how big that gap is. Next slide. Last but not least, drinking water affordability. Next slide. So our affordability assessment, again, this is all required through legislation. We're supposed to identify communities where they have customer charges that exceed an affordability threshold. We weren't told what that threshold was, so we had to develop something. And that's what our affordability assessment is. Next slide. I like to talk about kind of the different ways you can look at affordability before we dig into our data, because when we all talk about affordability, it's kind of like saying the word sustainability. We all think differently. So when we're talking about affordability in the water space, there are different lenses that you can look at it from. The first, which I think the majority of people usually think about affordability from, is from the household perspective. We all pay, for the most part, we all pay a water bill. Can you afford your water bill? Are you able to continue to maintain that service for your home? And so that household point of view, I think, is typically where people think about affordability. Connected to that is community level affordability. So you have you could have, you're able to pay your water bill, but maybe 4 of your neighbors can't. And as a community, your ability to collectively pay for drinking water services may be struggling. If you have a water system where the community isn't able to pay their bills, a water system isn't going to have the financial capacity to maintain a water system. So looking at community affordability can be important, because while one household may be struggling, if a whole community is able to support a water system, the community is probably going to be okay when it comes to maintaining clean drinking water for their customers. And that last one is that water system point of view. At a water system, I'm really worried, or I want to be concerned about community and household affordability, because again, if no one's paying their bills, or people have a hard time paying their bills, I'm not going to be able to make the infrastructure upgrades and improvements in order to run my water system effectively. And so a water system is either going to have to increase their rates, maybe decrease them. The decisions that a water system makes ultimately impacts then household affordability through their water bills. So that's all kind of interconnected, and it's important to think about these different perspectives, because the data that we have on affordability is in these different categories here. Next slide. And I don't have slides going into all of our metrics, but we do have different affordability indicators trying to tease out affordability in different categories. If you want to nerd out on it, it is on our website. But this is kind of the results of some of our work. So one of the things that we have to do is look at customer charges for water systems. We collect this data every year for the same volume of water. So it's kind of like if you to go to 5 different grocery stores across the state and you're trying to buy a gallon of milk, what's the price difference, across the state for the same product, the same gallon of milk? So here, what we're showing is the average monthly customer bill for 600 acre feet of water. And so you can see actually that small community water systems have the highest charges for the same volume of water compared to everyone else in the state. So on average, small community water systems charge, I think, between $30 or $40 more than large community water systems. I think this is important because I sometimes talk to people and they say, small water systems don't charge enough for water. I'm like, well, they are charging a lot more for water, but it still may not be enough because they have less customers to spread the cost around. But I think this speaks to the power of economies of scale. Large water systems are able to spread out the cost to a much larger customer base. So they're able to keep their costs a little bit lower, which is why you see that they have the lowest bills or customer charges across the state. And you can see fairly consistently, we're not seeing a huge uptick. It's just very gradual over time for customer charges statewide. Next slide. So what we do is we look at 3 different affordability metrics, and then if water systems are exceeding our affordability thresholds for each metric, we tally that up, and that helps us identify which water systems may be experiencing the most affordability challenges right now. Next slide. Right now, we see, you know, most customer charges that we're seeing across the state, we have low affordability burden, but we do have a handful of really high affordability burden and medium affordability burden water systems. You can see some changes in this data set here, or in the results, and that's because our data on affordability has shifted quite a bit over the last few years. Some years we have new data that we can use, other years the data goes away. We've seen changes in the quality of our data, so that kind of impacts some of the results here. But we've started to really get some good data the last 2 years. So that's why 23-24 looks a little bit smoother in the trends. Next slide, please. This year we're trying to, yeah, I was going to transition. So this year we're trying to include a tribal needs assessment in our analysis. And we've been working with our colleague Elizabeth in the Office of Public Participation, and she's going to go over some of that work. Elizabeth?
Thanks, Kristen. It's hard to follow that presentation. Appreciate it. Good morning. My name's Elizabeth Herrera, and I'm a Tribal Affairs Specialist with the Office of Public Participation at the State Water Board. And so in brief, I want to talk about our tribal drinking water needs assessment that we've done in collaboration with Kristen's team. In brief, it does mirror the larger needs assessment where the data was available. As you know, tribal drinking water systems, that data is not as readily available as it is with the public water systems. And so our work has been done a lot with collaboration with the U.S. Environmental Protection Agency, who does regulate some federal drinking water, federally recognized tribes drinking water systems. Next slide, please. So this is a very brief snapshot of the data collected from the United States Environmental Protection Agency, or US EPA. And there's going to be a correction on here that there's some new data that came out since these slides have been created. We're focusing on the federally recognized tribes because that is the data that is currently available to us. So this is data from US EPA. As you know, there are approximately 109 federally recognized tribes. Of those 109 federally recognized tribes, 60 of those tribes own and operate 148 water systems. So those 148 water systems, there's data collected by US EPA on those. Of those 148, it says 23, but it's actually 17, which is better than 23. There are 17 failing water systems. And when we say failing water systems, what that means is that US EPA provided the data they have to Kristen and their team, and they applied the criteria that they use for public water systems for failing to the tribal data. Now, it's not going to be a direct, like apples to apples comparison, because the data collected by US EPA is not the exact same as we collect here at the water boards for public water systems. So we say, as best as we can apply that data, we've come up, there are 17 that are considered failing equivalent. Then outside of those water systems, outside of the 60 tribes that have that data, there are 49 federally recognized tribes who do not have tribally owned water systems regulated by US EPA. And those will be the focus of outreach, continue to be our focus of outreach in the years to come. The other piece is not represented on this slide is that Kristen's team has helped to do, there's not as much data available for at risk, so we're not able to assess that because US EPA doesn't collect that same data again. And they are looking at the cost analysis in development and some funding gap analysis. So again, the tribal needs assessment, as much as the data is available, mirrors the larger needs assessment. In addition, what's not represented here is that there are over 55 non-federally recognized tribes in California. And again, that data about their water systems or how they're getting their water is not as readily available, but we continue as we work with tribes throughout the state to gather data to better understand their source status and needs of those tribes in their drinking water. Next slide, please. So what is the rest of the tribal needs assessment? We go through the analysis similar to the larger needs assessment. We also evaluate what funding opportunities are available for through the SAFER program, and we actively do outreach efforts to tribes regarding what's available, what are their needs, and how can we help meet those. SAFER has as you guys know, has very unique funding, and so there's opportunity for us to do a lot of collaboration with our state and federal partners like Indian Health Services and US EPA in kind of filling funding gaps that are available with tribes for drinking water solutions. And that's a lot of the work that we do, and that's reflected in the tribal needs assessment. Some of the unique funding opportunities is when there's a funding shortfall with another agency, the SAFER funding can often come in and fill that. If there's ineligible costs, some of our partners can only fund tribal homes, but if there's a community that has both tribal and non-tribal homes, SAFER funding can come in. That emergency urgent drinking water, O&M, operations and maintenance, is also a very unique area that the SAFER funding can move sometimes swiftly to come in and fill needs there. So that's kind of what the rest of the tribal needs assessment looks like. I just wanted to give you a brief overview, and it will be a part of the larger needs assessment when Kristen's team publishes that in the next month or so. So keep your eye open for that. Thanks, that's all I have.
Great. Thanks, Elizabeth, and thanks, Kristen. We're running a little behind on time, but we'll make it up. I want to use this time to open it up for questions and answers. So before questions and answers get started, I want to make sure that remind you all to raise your hand if you want to ask a question. Please wait your turn. When you are called, please turn on your microphone and speak slowly, and also limit your question or comment to 3 minutes. Okay, so are there any questions? Okay, so I'm looking at the list here. I'm sorry, I'm not sure who raised their hand first. So there's Jim and Chelsea. Let's start off with Jim.
Okay, thanks. My question is for Kristen. Kristen, great presentation. Thank you very much. I do have a question as far as the implementation of the new metric for at-risk systems and the capacity and hauled water issue. How is that going to be implemented at the state level as far as reporting?
So let me go back. So I think we added this new risk indicator to the analysis a year or two ago. So we've had it in our analysis for a few years, but this was before we had the new failing criteria. So because we didn't have it in failing, we made it in the risk assessment, you were automatically at risk. So it kind of overwrote everything else. So moving forward, we may change how we do this in the risk assessment, because now we can get those systems into the failing list. So we may shift how we calculate it and score it in future iterations of the risk assessment. So stay tuned. We didn't make any changes this year, but potentially next year or the year after. Now, in terms of data collection, what we started doing this past year, January 1st, 2023, was we launched a new required reporting platform called the SAFER Clearinghouse. It's called the Drought and Conservation Reporting. All community water systems and schools are required to report to us on a quarterly basis their kind of supply and demand levels, and whether or not they're relying on bottled water or hauled water to meet demand. That is the data that we use for the risk assessment. Before, we had to look at which systems we were giving funding assistance to. We didn't have a good data set, and now we have a much better data set. But that's how we've identified now all of these systems that had fallen through the cracks before. But we're going to continue to collect our data through that platform. And hopefully that answers your question, Jim.
Yeah, it does. And I have one more follow-up question, if that's all right.
Yes.
Sure, it'll be quick. On the slide, Kristen, that you had for the affordability of drinking water, there seemed to be on that graph, between 2019 and 2020, kind of a shift between affordability for small systems and medium-sized systems to kind of just a flip-flop for larger systems and small systems. What kind of happened between those years, if you have kind of insights, and if that makes sense?
You'll see that for almost all of our components of the needs assessment, quite a bit of a shift between our 2019, 2020 data and 21. We made a lot of changes across the needs assessment in terms of what data was included. And in particular, on the affordability side, there were some big changes that happened at that time. The first is that we started requiring water systems to submit to us their customer charges data. We made it required. So
That's right.
our previous data set was a hodgepodge of data that we tried to scrape together. It was really incomplete, really inaccurate. And now that we've required that water systems submit that data to us each year, the data quality and the amount of data that we're getting for all water systems is improving. So that's one of the reasons why you're starting to see, even on the customer charges side, the data to start to smooth out. But in terms of the assessment, in addition to new and better data, we made some changes to how the methodology works, which is why you see that shift too. It's all documented in our previous reports, which I know can be tedious to pull out. So if anybody wants to dig in, we're happy to go over the history. But it does speak to how powerful small changes or big changes in data or methodology can shift the results of the analysis.
Excellent. Thank you.
Thanks, Jim. Thanks, Kristen. Okay, so we have 4 more raised hands, actually 5 more to raised hands to get through before we take a break. So we'll go to Chelsea followed by Shannon. So if we can keep it to one question, that would be great. We can always get back to you on a follow-up question. So Chelsea, your turn.
Great. I'm looking at my list and trying to prioritize. I was really curious, Kristen, on the state small risk assessment. And could you explain a little bit more about why that I think high risk wells decreased from 600 to 200 or so?
I don't think we saw that big of a shift. I need to look at the results. We did see a little bit of movement, a little change this year in the results of this analysis. One of them is because there was a historical water quality data fix that was made. We caught a calculation error from our Gamma database, which is what we use to model groundwater water quality risk. And correcting that data point kind of resulted in fewer locations of state smalls and domestic wells getting higher risk points in that category. And that's one of the reasons why you see a little shift there. But for the most part, most locations have stayed pretty consistent from the last few years.
Okay. Yeah, I think I see kind of a flip between high risk and medium risk. So maybe that's where that difference lies.
And I'll get back to you. How about I send you an email?
Great. Thank you.
Yep.
Great. Thanks, Chelsea. Thanks, Kristen. Okay, Shannon.
There we go. Sorry about that. I was muted. Great presentation, good information. Thank you very much. There's a lot of information online, and on slide 36, you talked about the cost assessment and a link to that cost assessment. Could that be posted somewhere? Because there's a lot of information online, which is great, but I just want to make sure I'm looking at the right piece. So if I could get a link to that, that'd be great.
Yeah, so we haven't published anything for 2024 yet, so it's coming. And as soon as it's out, we'll share it. But there is, I can share with you, Shannon, a link to the white paper that we published in December that has the preliminary cost numbers if you're interested in that.
Yes, please.
Got it.
Thank you.
Mm-hmm.
Thank you, Shannon. Okay, up next is Isabel Solorio, followed by Kristen. Isabel.
Hola, hola, buenos días. Mi pregunta más que nada es, ¿cómo acelerar la consolidación para ayudar con los sistemas que están, que estén o están fallando? Es debido a que en mi comunidad, bueno, va funcionando bien, pero estamos teniendo mucha litigación con la comunidad cercana porque está muy renuente a la conexión. Entonces, ¿cómo acelerar eso? Es bien importante. Gracias.
I think that's a fabulous question, one that I'm probably not qualified to answer. I know that I have a lot of fabulous colleagues within our SAFER section, our engagement units, as well as our Office of Public Participation. Really, I think consolidation projects benefit from a lot of engagement and community dialogue, because there are a lot of conceptions and misconceptions around consolidation. And just by talking and coming together and trying to understand what a consolidation project might look like and what the benefits may be can help break down some of those barriers. But Isabel, I recommend connecting with our Office of Public Participation and Engagement unit section in order to figure out how we might be able to help facilitate some of those conversations.
Thank
Can
you,
I
Kristen.
can I
Go
also just wanted to respond to Isabel. I think one of the main things that we can do is to, to learn from other communities that have already gone through the process and help to communicate that to communities that are in the middle of the process and help to kind of help people to understand what it's all about, what the process looks like, what it looks like at the end, and maybe that can help to smooth things and make them go a bit faster while still allowing us to make sure we're engaging and getting everybody's ideas. But definitely very happy to talk to you about that at a later time. Thanks.
Thank you, Andrew. Okay, we've got two more folks who have raised hands. We'll go with Kristen, followed by Eric. And after Eric, we will go on a break. So Kristen?
Yeah, thank you. I have two quick questions, and maybe, Kristen, you can answer one. We can follow up about another. One is just, I was surprised to see technical assistants and administrators listed as long-term solutions in the cost assessment, in terms of, like, to me, they're like ways to get towards a long solution, but they're in and of themselves are not long-term solutions. So be curious how and why those are modeled as long-term solutions, and if they're mutually exclusive. So maybe you model a new well and technical assistance, for example. And then the second question is, I was looking back in my notes because I thought I remembered last year we talked about including large systems in the needs assessment. And I'm curious why that wasn't done, because it does seem like a lot of this data does exist for large systems.
Hi, Kristen. Yeah, thank you for your questions. So for technical assistance and administrator assistance, they are modeled as long-term solutions. They often are piggybacking on, they're not mutually exclusive, on additional modeled solutions. So for example, a failing water system that has consolidation as one of its long-term modeled solutions, and it's a small DAC system, we'd want to tie that in with some additional technical assistance to help them navigate a consolidation project. So we do see it as an important ingredient, if you will, in helping to implement those long-term solutions. We also model TA or administrator assistance for some of those systems that are on our failing list, but they're failing for not a water quality violation, but it could be for that multiple monitoring or reporting violation. So that's a system on the managerial side, maybe needs a little bit of hand-holding to help them overcome some of the managerial problems they're having right now. And if that can be done, perhaps achieve a long-term solution in making sure that they get their reports in on time and they come off the failing list. So it really is tailored, again, to the system challenges that we see in the data. Does that help answer the first question? Yeah. Okay, perfect. The second question is large systems in the risk assessment, something that we keep hoping we would maybe be able to do, but there's definitely some debate, both internally and with our stakeholders around the appropriateness of including large systems in the risk assessment. I think there's some opinions out there that some of the risk indicators are not applicable to large water systems. If you have feedback or ideas on that, please feel free to submit a comment letter or something to us. It'd be helpful, but that's kind of where the thinking is now.
Thanks, Kristen and Kristen. Okay, last raised hand is Eric Orellana.
I try to drop it in the chat just to save us some time. I can read it out loud, but
Yeah, I think I know it's a comment, but I think it's great to hear any type of kudos for the team.
All right. Well, I'll just
Yeah.
thank you to Kristen and the rest of the team at the Division of Drinking Water for their work in helping us understand the drinking water challenges in California. I want to call attention to two particular things I wanted to see more of. And it's one, to expand outreach and monitoring in domestic well communities. I think the data on there is still, we're still missing a lot of data. So getting a better picture. So that means funding. I think it leads to the fund expenditure plan discussion that we'll have soon, but we want to see more funding for monitoring and outreach to domestic well communities. And then the second thing, really important to the needs assessment and particularly to the fund expenditure plan, as we're seeing a lot of funding is going to interim water supplies, is identifying which costs could be attributed to particular actors, for example, nitrate contamination or groundwater sustainability agencies. It'd be important to see like which long-term costs are attributed to groundwater depletion or nitrate contamination, so that we can hopefully get some of those folks to help pitch in, and so we don't see the SAFER program putting a lot of its funding towards something that is the responsibility of others. Thank you.
Thanks, Eric. We have one more raised hand that we just saw, and that's from Michael Prado Sr. Mr. Prado Sr., can you please provide your question or comment?
Sure, no, I have a minute or you want me to do it after break? It no matter.
Mr. Michael Prado? Yes.
I'm going to do it now? Okay.
Yes, please. Yeah, thank you.
My comment or suggestion, when are we going to start helping the rural communities? For example, Cutler has 123 TCP, I believe, and nitrate, or DCP and nitrate. And I have family that lives there, and I know I'm quite a few friends. But when are we going to start helping the rural communities and providing clean, safe, and affordable water? The other one is in the community or the city. The city of Lemoore has contaminated water also. And how can we open up to provide water for the bigger cities also? It's a human right in the state of California for all. And for some reason, they're being overlooked. I'd like to bring that to someone's attention. Thank you.
Thank you, Mr. Prado.
Marina, maybe I can chat for a
Yes,
second?
please. Yes, thank you, Chad.
Good morning, Mr. Prado. Nice to see you. I wanted to comment specifically on Cutler, because the state board has been taking action or significant action there. So we're in maybe two things to mention. One, and they're interrelated, but one is that we've started the process to use mandatory consolidation authority to connect Cutler to Arosi. We're in that process, so we haven't yet issued an order there, but we are the state board is positioning ourselves to do that, because you make this great point of, Cutler has, the residents there have been, exposed to and suffering with nitrate, DBCP, TCP kind of, for the last 15, 20 years, and, they come in and out of compliance. And so I just wanted to let you know that we're taking steps there, and then now have a couple of funding efforts to make that happen. So anyway, just thought I would comment specifically, Mr. Prado. So
Thank you, Chad. I appreciate that, and good seeing you also.
Sure.
Keep up the good work.
Thank you, Mr. Prado. Thank you, Chad. Okay, there aren't any more raised hands. So at this point, we're going to take a 5-minute break, and I'm just going to say let's get, just to even it out, let's make sure we're back by 11:35. Does that work for folks? 11:35. So just it's a little bit more than 5 minutes, but I think we all can use one. So 11:35. Please come back by then. Thank you so much. Okay, it's 11:35. Let's head back to our meeting. If you can all rejoin and share your videos with us. Okay, can we show the next slide, please, so we can start with the remainder of the presentations? Can we have the next slide, please? Thank you. Jeff, whenever you're ready, we can get started.
Sounds good.
Okay. All right. So thank you all for, again, for bearing with us during our challenges this morning. But we wanted now to transition over to the next part of the presentation. And I'd like to introduce Jeff Wetzel from the Division of Financial Assistance. Jeff will speak to us about the draft priorities of the Fund Expenditure Plan. Also, if you can please follow along in your meeting materials packet on page 4. Jeff?
All right. Thank you, Marina. Like she said, my name is Jeff Wetzel. I'm a senior engineer over the Safe and Affordable Drinking Water Unit in the Division of Financial Assistance. And today I'll be talking about some of our efforts for the SAFER program for this current fiscal year as we begin to draft the fiscal year 2024-25 Fund Expenditure Plan. Next slide, please. So some of the discussion that we're going to be having after lunch today will be centered around the priorities and funding targets for the upcoming Fund Expenditure Plan. So let's start today with the adopted priorities from this year's Fund Expenditure Plan, which focus our efforts on small disadvantaged communities and low-income households. These priorities are not ranked in any order, and the needs of an out-of-compliance system are generally prioritized over an at-risk system. So I will walk through these one by one for you guys. The priorities are to address any emergency or urgent funding needs expeditiously, and that is only where other emergency funds are not available and a critical water shortage or outage could occur without support from the fund. Address community water systems and school water systems consistently out of compliance with primary drinking water standards or at risk of failing, or water systems relying on bottled or hauled water in the past 3 years. Accelerate consolidations for consistently out of compliance, at-risk systems, as well as state smalls and domestic wells that are near water system boundaries, and then also promote opportunities for regional scale consolidations. Expedite planning through the use of technical assistance for systems that are out of compliance, at-risk systems, as well as state smalls and domestic wells. Provide interim solutions, initiate planning efforts for long-term solutions, and fund capital projects for state small and domestic wells with source water above a primary maximum contaminant level or at risk of running dry due to drought. Provide direct operation and maintenance support to assist community water systems facing the highest affordability burdens while also promoting system sustainability. And then lastly, ensure our assistance is distributed in a manner consistent with the goals and the directions provided in the State Water Board's Racial Equity Resolution and associated action plan. Next slide, please. So these are our targets for the current fiscal year's appropriation of $130 million. Overall, we targeted $113.9 million to go towards projects. There was $15.9 million for interim water supplies and emergencies, We also carried forward $23.5 million for these projects from prior fiscal year appropriations. And then as a side note, not shown here on the slide, but we did receive a budget augmentation of $55 million for drinking water emergencies. And that was used to support our existing programs for hauled water and well repair or replacement. So then moving on, we had $15 million for technical assistance, $30 million for administrators, $3 million for planning, $20 million for direct O&M support, operation and maintenance support, and $30 million for construction. We also have $1.5 million for contracts, for example, data management investments, and then an estimated $14.6 million for staff costs. Next slide, please. So this slide touches on some of the SAFER program highlights from this last fiscal year. The Expedited Drinking Water Grant Program continues to be effective. This is a new process for state grant funds, which uses a streamlined application designed to get a construction agreement executed sooner. So a total of 29 systems were notified across 3 different phases of solicitation. 9 of those agreements have been executed. 3 agreements are drafted and issued, and then an additional 15 projects are pending funding approval. Next up, all of the drought emergency relief funds have been committed. These funds went primarily to our regional programs for bottled and hauled water, and then also our well replacement programs. So in total, there was about $105 million in funding that went to these programs. On the administrator front, there are 10 water systems with designated administrators that are being funded by the SAFER program. I wanted to note that overall use of an administrator is decided on a case-by-case basis and considers the specific needs of a water system. For example, if a designated water system lacks a government structure, then seemingly appointment of an administrator could be an effective measure to address a failing system. An update on our recent efforts for the direct O&M funding program. In late February, 30 Group 1 notification letters were sent out. So as a reminder, Group 1 water systems are ones with water rates that are above 2.5% of the MHI and also have a high affordability burden per the 2023 needs assessment. So out of those 30, we have 7 that have submitted applications, 9 that are interested and still in pre-application discussions with staff. And then 14 of them turned out not to be eligible, not interested, or non-responsive. So for the applications submitted, we are hoping to have those that first wave of those agreements executed later this year. I wanted to highlight that technical assistance is being provided to 47% of the failing water systems. Also wanted to mention that we continue to use the urgent drinking water needs process for long-term solutions where applicable. So funding was committed to 6 construction projects, totaling about $1.8 million. So for background, the current FEP gave us the authority to use the less cumbersome urgent drinking water needs process for construction projects that are less than 500,000 and are serving a disadvantaged community or low-income households. Those eligible project types are for systems out of compliance, at risk, or are supporting consolidation. And generally, these projects should be ready to proceed and shouldn't include extensive planning components or legal complexities. And then last up is the advanced payment guidelines. Those are being drafted and finalized internally. And shortly, those guidelines will be shared and added to the fund expenditure plan as an appendix. Next slide, please. So this slide shows all the funding sources that we have available for the broader SAFER program to go towards drinking water projects. So in total, around $773 million is available for use this fiscal year from the Safe and Affordable Drinking Water Fund, plus other complementary funding sources. At least $634 million is available for capital projects, although some of those funds are limited to certain project types, such as those addressing emerging contaminants. Next slide, please. So the last slide showed us the funding that is available, and this slide is showing us this year's funding commitments by solution type. So this pie chart does represent funding commitments as of March of this year for the broader SAFER program. It is a snapshot at this point since we are still within the current fiscal year. So these numbers will change and increase as we close out the fiscal year on June 30th. But in total so far, there has been $540 million committed to projects this fiscal year. And the bulk of that funding is for construction projects and the domestic well programs. Next slide, please. So now we're going to switch to look at some of the SAFER program performance cumulatively since 2019. We have provided interim solutions to 292 communities and about 4,600 households. There's been technical assistance projects for 501 communities, 88 of which are for planning via technical assistance. We have executed or completed planning assistance projects for 60 communities and completed construction projects for 148 communities. So again, these totals represent the broader SAFER program, which is the Safe and Affordable Drinking Water Fund and other complementary funding sources. And in total, this equates to over $820 million in funding, benefiting approximately 1.5 million people. Next slide, please. So for this slide, we're going to, when we're now shifting to only looking at the Safe and Affordable Drinking Water Fund specifically. This slide I did share with you guys at the first advisory group meeting of the year. It shows the total funding and percentage split over the past 4 fiscal years by solution type. So the largest solution type is technical assistance at a little over 40% of the funds committed, equaling $206 million. Construction is the second largest solution type, shown at $136 million. And most of that was committed in the first 2 years of the SAFER program before the State Water Board received a large amount of other state funding for drinking water infrastructure projects. And then another significant use of the fund is for interim solutions. Interim solutions are things such as point of entry, point of use filtration devices, along with bottled water or hauled water deliveries. And these investments largely support the domestic wells and state smalls through our regional or countywide programs, as well as the co-funding agreements to complement work under CB salts. Next slide, please. So this slide is aimed to capture the anticipated funding going forward. There is an estimated $1.1 billion in broader SAFER program funding for drinking water projects over the next 3 fiscal years. And then if we're looking at the next 3 years, we should also consider the available funding that is remaining in our current programs, which includes the regional domestic well programs, technical assistance agreements, and the administrator master agreements. So there's closely $300 million remaining in all 3 of those combined, with roughly $98 million for the regional domestic well programs, $170 million in technical assistance capacity, and then $30 million remaining for administrators. Next slide, please. So looking ahead, these are the next steps for the draft fund expenditure plan. Internal reviews of the plan are happening now, and the anticipated public comment period should start in late June. And then there will be a board workshop and also the 3rd advisory group meeting in July. And then we will respond to comments and revise the plan and bring it back to the board for their consideration at an August board meeting. Next slide, please.
Okay, thank you so much, Jeff. We're now going to use this time for folks to raise their hands and ask questions of Jeff. So if any of you have questions or comments, please raise your hand. And I will call on you as soon as we see those hands up. There's one hand. Sorry. Oh, Jim Sullivan. Sorry. Thank you for, Jim has his hand up. Go ahead, Jim.
Sure. Thanks, Jeff. I have a question on your graph for fiscal year 23-24, where you had $89 million dedicated to private well projects. What basically were those? Are those monies going towards? It seems like it's great, but I was just wondering what they were going towards.
So that portion of the chart and that money for domestic wells is largely going to support our regional and countywide programs and agreements with a few counties and then some of the nonprofit organizations like Self-Help Enterprises and RCAC and Community Water Center.
So not necessarily statewide, but for specific entities across the state?
Yeah, RCAC's program is statewide. Self-Help's is for their 9 counties in the South San Joaquin Valley.
Okay.
Yeah.
Thank you.
Thanks, Jim. All right, so we have Rami it's going to be followed by Shannon and then Soren. Rami, go ahead.
Oh, hi, Jeff. Good morning. Rami Kalon here. A question on one of your slides, the fiscal year 23-24 safer highlight slide. You mentioned that on technical assistance, 47% of failing systems were being provided technical assistance. Are those the, I don't know, 386 or so that Kristen mentioned that are currently on the list? 47% of those are receiving technical assistance? Thank you.
I believe so. There's another stat that was in my presentation that I didn't read that might be helpful for you on that one. So for that technical assistance effort, there was, and this is to about March of this year is when we pulled the numbers, there's 240 work plans for a total of $69 million in funding going towards these systems. And I assume the overlap there is consistent with the numbers that Kristen showed.
Thank you.
Thanks, Rami. All right, Shannon, followed by Soren. Shannon, are you with us? I'm not sure if you dropped.
Nope, I'm here.
There you go.
I'm
Okay.
putting myself on mute.
Good. Okay, cool.
Great information. And as I'm digging into some of this, being new member on the board here, for the technical assistance, we have 42% of the money's being spent there, or 200 million or so. Can you give, I'm not super close to that. Can you give some details on what exactly, and this is just to get it into my head, technical assistant, like what is that bucket for technical assistance?
So the technical assistance agreements that we have are with nonprofits to provide planning efforts and filling out applications and outreach. We also do have technical assistance providers that are now engineering firms that provide this work. So, I mean, at the very high level, right, there's communities and systems out there that are not able to do kind of the upfront work to get them to a solution or a construction project that needs to be implemented. And largely that's the technical assistance that's kind of filling that void.
Okay, so that would be potentially like working with engineers and designing up systems and stuff like that, right?
Correct. Yeah. Doing environmental documentations if needed, income surveys, water rate studies, things of that nature.
Okay. All right. Thank you.
Thank you, Shannon. Okay, we've got one more hand up, and that's Soren. Soren, go ahead.
Thank you. I have 2 questions. The first is on slide 62, which refers to the SAFER program accomplishments since 2019. I'm hoping you can help me understand, because I think one of the challenges with this work is understanding the universe of need and how much progress we've made in, chipping away at that need. Can you tell me what sort of overlap there is in, each of these categories says, 117,000 people helped, 515,000 people helped. Does that mean that they now have safe drinking water when they didn't before? And B, is there overlap? Like, are some people being counted multiple times between categories where maybe some combination of TA and planning got them access to safe drinking water, or are these just like individual people we're talking about? Does that make sense?
Yeah, no, I think the question's clear, Soren. Thanks for asking it. And I think Chad from Division of Drinking Water can chime in too. But those numbers are categorized under that umbrella of the solution type, right? So I believe the populations there would be populations that benefited from technical assistance, which might not necessarily be at this point, a completed construction project per se. But I'll let Chad chime in if he has anything to say.
I think that's right, Jeff. And Soren, you make a good point of there could be some, since it's bucketed as dollars spent, it could be that a particular community needed multiple streams of resources. They needed TA, and then they may have needed planning. And then, most communities will need construction funding. I think that overlap is kind of small-ish, like it's not 50% are in multiple buckets, but it is a nuance. And I think anyway, I said it before, I think that's great to point out that there is some.
Yeah, if we could have the slide to go back to slide 62, I think it would help the discussion. Slide 62 is the SAFER program accomplishments. There we go.
Yeah, thank you.
Mm-hmm.
That makes sense. I know that's probably really challenging for staff to quantify and do the analytics on. So I appreciate that answer, Chad and Jeff. I did want to also, just while I have the floor briefly, I wanted to echo something that Eric said before the break on sort of the overlap of trying to get at the domestic well issue. And just because there are so many dollars from SAFER going towards domestic wells, there's a lot of other programs out there trying to get at similar issues, GSAs with their well mitigation plans and other programs at the board. And I wonder how the board is thinking through not having multiple programs try to get at the same well and solve the same problem. I know that's probably also really tricky to parse out.
I'll get Soren, I think your comment is really awesome, which is I guess I just wanted to point out that the board is thinking through that question, and in some cases actively working. A good example is in the kind of central San Joaquin Valley, using CV salts programs, management zones are trying to address nitrate, and state board is stepping in to have some synergy there to if there are other contaminants to address those with state board funding. So I just wanted to mention that example as a demonstration that it's happening. But those aren't, like you mentioned, those aren't the only two kind of resource streams, and they all go together. So yeah.
Thanks, Chad.
Yeah, sure.
Great. Thanks, Chad. Thanks, Soren. Okay, so we've got a few more hands up. And so we'll go with Eric Orellana, followed by Michael Prado, followed by Isabel Solorio, and then Silverio. So Eric, go ahead.
All right. Do you mind if I give my spot to Silverio? I can go at the end if that's okay. I just don't.
Well, we actually like to get folks in the order that the questions are received.
Okay.
So
All
if
right.
you can just go. Yeah, thank you. We'll get to him. Yeah, thanks.
Want to have him waiting. All right. So I had a few questions. The first question is just a clarification question in terms of the planning and TA buckets. Was hoping to get some clarification around if sometimes planning funds are considered technical assistance? Could you share a little bit more clarity about that?
I think hi Eric, nice to see you. I think the vice versa of that is true, is that some technical assistance funds can be planning, right? If that's the use for them too. But the planning bucket here that I think we're staring at is for water systems or entities that came in themselves and applied for planning grants, rather than having that planning being done under technical assistance.
Okay, thanks for that clarification, Jeff. And likewise, good to see you as well. And then the next question I had was around the drought funds. And then I think it's a similar question that you had that was answered earlier, but just wanted to clarify. So it was in the highlights, we see $105 million fully committed to projects for drought funds. And then you also mentioned an 80 or 90 or so $1 million primarily for domestic well programs. Could you explain a little bit of like, does that mean only that 10, 15 or so million has gone to infrastructure drought projects?
No, so all of that 105 million has gone towards our regional domestic well programs. It was given to us in two chunks. We had 50 million from, I believe, 2022, and then 55 million from 2023. So that's why the pie chart might not line up there and is showing something different, like 89. But yeah, those funds were committed to some of our regional programs that address drought and hauled water, balled water, and well repair replacement.
Okay, thanks a lot for that. And then the last question was, I think this is a question/comment. I think it's like this breakdown that I'm seeing here in terms of like the costs and then also what's the targets is really helpful. But I think one of the things that would also be helpful is like a list. I know it would be a very long list, but of what the SAFER program is funding. I think when I look at the intended use plan, it's a lot clearer in terms of what's getting funded or what could be funded. So I think probably getting that I think for me would help just be able to better give feedback for in this group and to see what we want more funding to go to, see some of that.
Eric, what slide are you referring to so that we can just be on the same page? Is that the SAFER funding commitments?
This is yes. Yeah.
And okay, Michael Ben, can we go back one slide, please? Is this one?
Yeah, so that's great.
Very good.
And I think just a little bit more detail on like,
Mm-hmm.
You've got 400 million in construction.
Mm-hmm.
Which projects, like which communities is that going to? And getting that in.
Good point. Thank you, Eric.
This is Jasmine. I just wanted to chime in on that one, Eric. The fund expenditure plan, when it does come out, will have an appendix that lists out all the water systems that received funding the prior fiscal year. So if you have access to the currently adopted one for fiscal year 2023, 2024, that would show the kind of prior fiscal years list of systems. And then, as I mentioned, when the new one comes out, it will detail this particular slide a bit better.
Thank you, Jasmine. All right, great discussion. Very good. Okay, so on to the next commenters, Michael Prado Sr.
Yes, where can we get a list of the other TA providers that are available?
Good question, Mr. Prado. I believe we have a list of our TA providers that are posted on the website. We can track that down and share that with you.
Yeah, please, because I keep hearing that there's other ones out there, but never a name put to the other ones out there. And that'd be great to know who. Maybe we know how many's out there and who they are. And we may have to add more. There's a lot of things happening, and it's sure not going to get no better. Thank you.
Thank you.
Thank you, Mr. Prado. Okay, we have Isabel, followed by Edwin, followed by Sarah. Isabel.
Sí, mi pregunta más que nada es, quiero saber en qué área está la gente, por ejemplo, pozos de personas que no son de bajos recursos y están pasando, sus pozos se han secado. ¿Qué los planes que tienen en este presupuesto para ayudar a esas personas y a las tribus también? Porque estoy escuchando que hay también esos problemas en esas áreas. Gracias.
Good question. So all of our funding for the domestic wells are tied to low income and disadvantaged communities. And a good portion of our established programs are within the San Joaquin Valley in the self-help service area through those 9 counties. And we do also have some other programs in some other counties, Shasta and Santa Cruz, if I recall off the top of my head. And then RCAC's program is statewide that can serve domestic wells. And then lastly, there's CWC can help the domestic wells on the Central Coast.
Thank you, Jeff. Okay, apologies. I want to make sure Silverio is able to make a comment. Earlier, I mentioned that he would be going after Isabel, so I just wanted to ask Silverio to join us now, provide this comment or question.
Sí, buenas tardes. Pues, disculpen, gracias por darme la oportunidad es un comentario. Y pues, en realidad, estoy aprendiendo bastante en todo esto y pues yo quiero comentarles que nosotros estamos beneficiados y agradecidos también por el agua que estamos recibiendo embotellada. Y nuestra meta es tener un sistema directo en nuestras casas, pero también estamos mirando otras comunidades con la misma necesidad acá en nuestra área. Acá para el condado de Monterrey está muy contaminado los pozos domésticos. Entonces, pues hay mucho trabajo para hacer y es un trabajo duro, difícil para las organizaciones sin fines de lucro que están haciendo. Yo estoy asombrado cómo lo están llevando a cabo. Es un gran trabajo. Nosotros estamos muy, muy contentos aquí en nuestra comunidad, ¿verdad? Que nos han ido guiando y pues está muy bien. Queremos que pues seguir apoyándonos ustedes y nosotros. Bueno, nosotros hemos necesitado la comunidad y ahí tenemos a las organizaciones de lucro, en nuestro caso el Centro para el Agua, que ha hecho bastante trabajo para nosotros y pues seguir adelante para lograr el propósito de que tengamos agua limpia y sea mejor para todos, para bien en común y muchas gracias. Muchas gracias por todo.
Gracias, señor Pérez.
Gracias a ustedes.
Gracias. Jeff, are you there?
Yeah, I'm here. I mean,
Okay.
so thanks for the comment as well. Yeah.
Okay, sorry. I was just like, okay, thank you so much. Okay, gracias, señor Pérez. Okay, we've got 2 more hands up. So we'll move on to Edwin, followed by Sarah.
I got two sort of questions, I think. One might be too technical for this, but so I understand we do the technical assistance and then the interim supplies were would any of that be going towards updating SCADA systems? And would any of that funding be could be used for subscriptions? Because I know that software tends to be expensive for maintenance and stuff like that for water systems. And then I have a secondary question, which is with the new push from the state to get the treatment plants to start redistributing water once it's been treated and it's high salts, the TMDLs that come out of it, for water systems, it tends to cause a lot of corrosion. Are we going to be looking at maybe including more money for older systems that are gonna be failing due to higher salts in water if those systems do get introduced to refurbished water from the treatment plants?
Thanks, Edwin. Both good questions and both pretty technical. I mean, on your first one, I'll just mention that the sounds of those SCADA systems and things like that would probably fall under construction projects when it's associated with, you know, a larger type construction project, maybe whether it's replacing a tank or something like that. Happy to have that more nuanced conversation with you offline. And then your second question again, can you help walk me through that again?
Because I understand that there's so for in my field, one of the things that we're looking at is using reconstituted water from the treatment plants. And a lot of those systems are going to be injected, and we're looking at a lot of salts. And I know that our systems we're going to have to deal with salts in terms of in the parks and things like that for the piping. Now, if the state does push to have that water, because that water comes out perfectly clean, it's actually cleaner than a lot of the water that's out there, but it has a lot of salt, and it can cause corrosion in pipes. Is that something that is going to be looked at down the line to help communities that are in need of water?
I mean, I don't know that specifically, but I mean, if you're talking about just general kind of preventative maintenance or repair,
I guess so,
for failing infrastructure, those are eligible project types down the road.
Okay, I'm just curious. Thank you.
Yeah, maybe I'll chip in, which is, yeah, I mean, as individual solutions are looked at and then implemented in communities, you know, some of that technical analysis is if there is a change in water source or water quality and how that would affect, you know, not only distribution systems, but also internal piping in folks' homes. The last thing we want is, well, and so one of the considerations there, like you were talking about, is corrosion. And so if it's necessary to implement some sort of corrosion control, certainly an eligible cost and would be, you know, implemented with the solution. So the last thing we want to do is implement a solution that cures a problem but introduces another one, right? Like, we want to be smarter than that, and we are smarter than that. So yeah.
Okay, I'm just pops into my head.
It's a great comment, and yeah, maybe something that people weren't thinking about 20 or 30 years ago, and yeah.
Okay, thank you.
Yeah.
Okay, very good. Thank you so much. One more question, and that's from Sarah. Sarah?
Hey, I just wanted to echo what Eric had said earlier and comment on the list of currently or previously funded projects that are included in the appendix of the fund expenditure plan. I think this has come up a couple of times before, and it's come up in multiple conversations I've had in other places too. And I would just ask if there's some way to make that list and the information in that list more readily accessible. Even if it were posted to the website, I think a lot of people are very much interested in the projects and their status. And I've seen the list before. I think another added feature that would be incredibly helpful would be geolocation, whether it's coordinates or address, or some way that we could map those things would be incredibly useful. And so I think there's a lot of us very interested in that information and just asking to make it easily accessible. Thank you.
Sarah,
go ahead, Jeff, please.
I was just going to clarify, Sarah, you're not only talking about like past commitments and past projects, but also like active funding agreements and stuff of that nature as well. Okay.
Correct. Yeah. I mean, things that were completed 10 years ago, maybe not as relevant as like what's the current status of what you all are funding right now or intend to plan in the next year.
Yeah, I wanted to comment, Sarah. I know you've worked with us on the snapshot tool that we've developed to show, to take a step towards, I think, what you're talking about. And I think we understand the evolution of that tool should be like where in like maybe a timeline is that particular community on its way to a solution? Like when do we expect the solution to happen? And how long, have they done what steps have they also completed? I may be putting words in your mouth, Sarah, so please correct me.
No, I'm not gonna. I think that's a great idea too. I like that concept as well, but I'm just referring to something much more simplistic. Like I've seen the Excel file; it's been useful before, but the real-time information that's a whole nother lift for you all. I'm asking that appendix in the current fund expenditure plan be easier to find, easier to use, and include geolocation information. Yeah.
Got it.
Yeah.
Thanks, Sarah.
Thanks. Yep.
It's a great discussion and participation. Thanks everybody for all the good feedback and questions and comments. Lots of really great ideas and expertise obviously here present. Okay, so if we can please advance to slide 67, please. Okay, so before we go on to lunch, we'd like to give you a quick overview of the Microsoft Form. Next slide, please. We will be using the Microsoft Form platform this afternoon to receive your feedback on the draft priorities for the fund expenditure plan. Okay, give me a second. So just really quick overview. What we ask you to do is to just open the form that's on your connected device. Select the language at the top right corner of the document. So if thanks, Caroline. Caroline just inserted the QR code in the chat. So I'll give folks a minute to access it. But we wanted to give you just a very quick tutorial on how to use it. So really, when you do open it, again, open the form on your connected device, select the language on the top right corner. It'll pop up as English, or you have the option of Spanish, and you would start the survey. Next slide, please. So to provide your feedback, you can start clicking or tapping on on the proposed question on the options. I'm not sure why it's not showing up on the slide. Okay, there we go. Thank you. So on the MS form, you're going to have options. So just a quick tutorial again. You can click on either yes or no, or tap on yes or no to answer the questions. On the comment box, you can write in a response. And then for the other section, you can block and drag up your options, drag it up to the position you want by using the up and down arrows. Okay. Next slide, please. Okay, so I know this is a little wonky right now, but if you have questions, some of you may be familiar with MS Forms and may not have questions, but if you do have questions on how to use the MS Forms, we will stay on for the next few minutes during the lunch break. So at this point, we're going to go ahead and break for lunch. And it is a full hour lunch, so it is 12:20 right now. If we can please come back, return by 1:20. Okay, break for 1:20. And if folks have questions regarding the MS Forms, we will stay on to help and answer any questions. Have a great lunch, and we'll see you at 1:20.
Hi, Michael Prado, Senor. This is Caroline speaking. I think I see your hand raised.
How do I get into the form?
Yes, so on the in the chat, I just chatted the link, or there's also a QR on how you want to access it. You can click on the link, it will open it on your computer. Or if you want to use your phone, you can scan the QR code and the form will appear on your phone. You have two ways.
Okay, no, I already opened the link. I hit the link. I hit the links on my will come up then when I get to know.
Yes, and so there's a few little questions. So yeah, it asks if you want to identify yourself, and once you do that, you can click on next, and there's 3 questions, and it just as a practice for the type of exercise we will have in the afternoon.
Thank you.
You're welcome.
And if there's any questions, Mr. Prado, you know, if for whatever reason the form doesn't work out for you, we can obtain your feedback in another form through email, perhaps. Okay. All right. We'll see you all. Okay. Okay. Is there anybody else who needs some support or has questions regarding the MS form?
Ya, yo, Isabel,
Isabel.
porque estoy confundida un poco con esto.
Ok, la escuchamos.
Sí, porque, o sea, no sé cómo moverlo, y más como estoy batallando con mi ojo, o sea, estoy un poco confundida.
Entonces, lo que pasa, bueno, tiene un teléfono a la mano, creo que sería la opción más fácil, y y para poder escanear el código QR que está en el chat de la reunión. No sé si ve el chat de la reunión.
Espérame, déjame, entonces, dame un segundo.
Sí, claro que sí.
Oh, sí, aquí está un código.
Así es, entonces lo puede escanear con su teléfono
Dame un
y
segundo.
y le abre un formulario en línea.
Ya.
¿Sí? Y ahí a la parte de arriba puede seleccionar el idioma, está en español o en inglés.
Sí, ajá, ya miré, ahora sí. Ok, gracias.
Sí, gracias.
Ok. Gracias, Caroline.
No, ¿de qué?
Isabel, sí.
Gracias.
Ajá. ¿Cómo no?
Qué bueno.
Is there anyone else that needs support? We're here to help. Walk you through it.
Sí, yo tengo el mismo problema, disculpe.
Ok, sí, sí, señor Silverio. Entonces, no sé si puede ver el chat de la reunión. Es un, ¿cómo se llama? Como todos los mensajes que nos estamos mandando y que les estamos mandando. Entonces ahí si va un poquito para arriba, porque ya hubo más mensajes, o puedo volver a pegarlo. Hay creo que lo más sencillo es que si tiene un teléfono,
Perdón,
lo escanee.
Carolina,
Sí,
perdone.
sí,
¿Sí me
dígame.
escucha?
Sí, le escucho, sí.
¿Me puedes ayudar? Necesito llenar un cuestionario. Sí, estoy
Pero,
algo
señor,
ayer.
señor Silverio,
Sí,
yo recibí ayer una de sus respuestas. Es el mismo formulario que usó ayer como práctica.
oh, sí, es el
¿Sí?
mismo, porque yo lo
Sí,
llené ayer.
sí, sí, es como, o sea, queríamos aprovechar de ese tiempo ahora para poder verificar porque no todos habían tenido tiempo de contestarlo y saber si estaban, bueno, si podían usarlo, si necesitaban cualquier tipo de ayuda, porque en la tarde vamos a tener ¿cómo se llama? Otro formulario, pero para saber si tenía acceso ya ahora que estamos en una reunión. Acabo de poner el enlace y la imagen del formulario. Y
Sí,
creo que lo más sencillo es usar su teléfono, ¿no? Porque al parecer estaba en la reunión con una computadora, ¿verdad?
sí, tengo una tableta.
Ok, con la tableta, ok. Sí, entonces para que no le cambie la imagen, si quieres desde la tablet, puede, desde la tablet, a ver, estoy viendo. ¿Cómo se hace? Si desde la tableta puede buscar dónde está chat y ahí le va a aparecer el enlace y o la foto del formulario, que es un código QR.
Ok. No sé.
No sé si lo pueda ver.
Sí, estamos buscando.
Ok.
Pero sí contesté uno ayer.
Sí, eso, va a ser el mismo ahorita. Era nada más para prepararlo en la tarde que vamos a usar el mismo proceso. También si revisa los emails que envía un email anoche con el
Ajá.
formulario que usaremos esta tarde. Entonces, si es más fácil para usted abrir el formulario desde el email de anoche, eso será a partir de la 1:20 ahora.
Sí.
¿Ok?
Ajá. Entonces, pues estamos batallando para encontrarlo, pero ¿es necesario llenarlo ahorita o pues?
No, era nada más para saber si podía tener acceso y si tenía cualquier tipo de dificultad técnica con él. O sea, ¿ahorita está en la tablet o de dónde me está hablando?
Bueno, sí, me estoy hablando con usted de la tableta, pero tengo el teléfono donde recibo los correos.
Ok. ¿Y su tablet qué tipo de tableta es? ¿Es una Apple o Samsung?
Es Samsung, ¿verdad?
Samsung. A ver, deme un segundito. Voy a intentar ver cómo aparece en pantalla para decirle exactamente cómo hacerlo. Si me deja. Deme un segundito.
¿Me aparece?
¿No le aparece el chat de la reunión?
Eh, ¿Puedes hablar?
Sí, sorry. Aquí estoy, abriendo el correo que le mandaron ayer a mi suegro. Estoy donde dice acceder el formulario. Este, ¿Conoce usted el link?
Hay un link. ¿Es de un email de anoche?
Sí, exacto.
Ok, entonces, si quiere dejarlo abierto, todavía no está disponible, lo pondremos disponible a partir de la 1:30 esta tarde, pero va a ser el formulario que usaremos en la tarde. Entonces,
Okay.
si ya lo tiene, ya puede usarlo, lo usaremos en 1 hora cuando regresemos de la comida.
Okay, so
¿De
no
acuerdo?
está hasta ahorita, sino más rato. Okay.
Así es, así es.
Muchas gracias.
No, ¿de qué?
Gracias.
De que nos estamos viendo a la 1:20,
1:20,
regresamos.
sí. Gracias. Okay, ¿alguien más? Anyone else that has questions or would like to walk through the MS form document? Nope. Okay. Gracias, Caroline.
Nos
Regresamos
vemos.
a la 1:20.
1:20.
Gracias.
Bye.
Bye.
Caroline, can you see my screen?
Yes, I can hear you. See your screen. Sorry, see your screen. Sorry. Can you
Is
yeah.
this the right link though? Can you put the one in chat for me? I just want to make sure because I went to go share.
Yes, this one is the edit one. So, but can you please share the PowerPoint? Because we are still on lunch. So if you can share the screen with the lunch time and
Yeah, I need to get the link to that.
yeah, I can send it to you. If you
Thanks.
want. Yeah. Because when we are coming back, we will need to have, the quick presentation, and then we will switch to the MS form, and I will also send you this. The link.
I just want to make sure we're using the right form too, because when I
Yes.
did collect responses, it gave me an error message.
Yeah. Oh, yeah. You know why? Because it's because the public link is not available yet. I put it available starting at 1 something because you want it only, available when we are talking about it. So that's why. But so the link you show me right now is the one for the editor link, but it will be available for the meeting. So let me give you the PowerPoint first. Just a minute. Okay.
As long as you put in like our Teams chat, the one you
Yes.
want me to share later, I'll just pull that up. No problem.
Yeah. And then I will so so it's on, I put it in the chat.
Perfect. Bringing it up.
Yeah. And it's slide 70.
Thanks.
And if you can please rename yourself as presentation in English, because when the members will come back, they will need to reselect your
For me.
screen. Yes.
Let's see.
And I will rename Michael then, because it's not sharing right now.
Do you want me just to put like my name is English or something?
No, presentation in English, a dash and your name. That will do.
Okay.
Because then right now I will need to call AV services, so they will select your screen, but also.
Okay.
Yeah, that's perfect this way. And let me check because I have to stop sharing multiple participants. Okay, so now you should be able to share your screen.
What I need to get to slide 17.
Yeah, 70. Yeah, 70.
Oh, 7.
Yeah.
And there now. Cool. And I'm sharing my screen.
Perfect. And if you can put it on presentation mode, please, so that looks nicer.
What time do we come back at? 1?
Yes, but 1:20. I'll do the same on my own. Okay. Okay. So that's good. So I think it's good on your hand. I will now we'll call AV services so they can select your screen.
Perfect.
And select mine. But you're
and then share the forms link with me just in case I'm on
yes,
the wrong one.
Sure. So
And then we're all set.
yeah, I believe so. Thank you. See you after lunch.
Of course, no problem.
Bye-bye.
Hey, folks, it's 1:20. Welcome back from lunch. As you return, if you can please turn on your cameras so that we know that you're here.
Recording in progress.
Let's see. Okay, folks, are we ready to continue? Yes. Okay. Okay, great. So we're going to go ahead and get started. It is 1:22. Welcome back. We hope that you've had a great lunch, maybe had an opportunity to get some sunshine, some fresh air. So before we get started, just wanted to remind folks that interpretation services are being provided and to make sure that they're on the channel that they were on at the start of the meeting. If there's any challenges or issues with that, please let us know and we would make sure to support you with that. Okay, so we started the morning with an overview of the needs assessment results and the draft fund expenditure plan. So during this next hour, Kristen and Jeff will facilitate a discussion so that you can provide feedback on the draft fund expenditure plan. Kristen will guide us through the Microsoft form. So please make sure that you have the form open. We sent you the link and the QR code via email a few days ago, and Caroline has also placed that in the chat. Caroline, can you place that in chat once more so it's fresh on everybody's? Yeah, very good. Okay. Also, please note that the feedback that's being provided on this forum is anonymous. If there's any challenge that you have with it, again, please let us know. And we want to hear your feedback. If the MS form for whatever reason is not functioning for you, we can obtain your information after the meeting. So at this point, again, welcome back. And I want to reintroduce Kristen and Jeff. Kristen?
Thanks, Marina, and welcome back, everybody. This is our first attempt at using this kind of survey platform with the advisory group. We're hoping that it's useful and that you guys find it fairly easy to use. We're going to walk through the questions. Feel free to listen to me or not. And you can interrupt me too to ask a few clarifying questions if that's helpful. Maybe, Marina, you can keep an eye out for raised hands.
Absolutely. Before we get started, Kristen, can we maybe ask folks, do they have the form open either on their laptop or on their phone?
Recording stopped. Recording in progress.
I don't see it. All I see is the test one in the chat.
Caroline,
I'm sorry. This is Caroline. I just got disconnected from Zoom, so I'm back. I don't know what happened. There was a glitch here, so I'm back. I will start sharing the links. I don't know what you said, but I will share all of this. Okay, give me a second. I'm trying to come back.
Thank you.
So just to let you know, also there will be I will be sharing my screen in Spanish, so maybe you will see my screen first. So just remember to reselect the screen. Thank you. And I think the interpretation is off. I'm trying to redo this. Okay. Thank you.
Yeah. So again, just a real quick recap. This form can be completed in English and Spanish. If you look at the corner, you can select English or you can select Spanish. Okay, so it's available in both, and Caroline and I will be on hand to support as needed, and I will be keeping an eye for raised hands. Okay, so Caroline, are we ready to get going?
Marina, I put the
Yes.
hyperlink in chat to everybody, so hopefully,
Very
Sarah, were
good.
you able to click on it and open? I'm seeing a nod. Yes.
Very
Awesome.
good. Okay.
Cool.
Go ahead.
Alrighty. Well, it's not a very long survey, but I do want you to spend a little bit of time thinking about it. This is not something like you just bought something from a store. We are going to go over everyone's responses together after this. You will be anonymous though, so don't worry, we're not going to be showing your name, but we are going to look at how everybody has responded. So the first question here is asking for you to arrange the community types by the highest priority, that would be at the top, to the lowest priority, assuming all systems are disadvantaged communities. So you can see on my screen, I can click and drag. How would you rank these types of communities and water systems for priority for safer engagement? There's also these little arrows, but if you're on your computer, you can click and drag. Okay. That's question number 1. Question number 2, and we're going to pause and let everyone have time to digest this. I'm just walking you through them. Question number 2, the safe and affordable drinking water funding for fiscal year 24-25 is approximately $130 million. What percentage would you allocate per community type trying to get to 100%? So this is kind of like a budgeting exercise. You know, you make so much money a month. Where are you spending your money this month, right? So you can see here we have similar water system types and communities. So there's failing public water systems, at-risk public water systems, state smalls, domestic wells, tribal systems. You can click the bubbles to indicate the percentage for each. And then maybe you have a piece of paper on the side adding up the percentages that you're selecting, trying to get to 100% allocation of that $130 million. So again, this is going to help us understand how you would prioritize where we try to target our funding resources. So there's failing public water systems, at-risk public water. Sorry, could you repeat that question?
I think that was your echo coming through.
Oh, okay. Maybe if everyone can make sure they're muted. Okay. It's weird hearing your voice back at you. Number 3, arrange the solution types by highest priority to lowest priority to receive safer assistance. So this is similar to the first one where you get to drag and drop, where at the top of the list would be your highest priority, and at the bottom of the list would be your lowest priority. So kind of like you're going to the grocery store and you're choosing, you know, what is the one thing or the few things you have to walk out with, right? What would you prioritize here for where we focus our funding resources? We have, well, I've already reordered them. We've got construction. So this is putting in infrastructure assets, if you will. We have planning assistance. So this is helping with engineering reports, doing options analysis, that type of stuff. Technical assistance. This is coming in. This could be doing a rate study. This could be helping with thinking through an asset management plan, a capital improvement plan. This is more hand-holding, right, at the water system or community level. We have direct operation and maintenance. We had a question earlier today around, you know, do we help with SCADA and the costs of that monthly subscription? So these are ongoing costs that a water system will accrue in maintaining and operating their water system. Do we want to be supporting ongoing operations and maintenance? Administrator assistance. This is that next level above technical assistance. This is really, we're bringing in a professional to make a lot of really important decisions at the local level. It's a unique category of funding and assistance that we offer through the SAFER program. And then interim water supplies and emergencies. So this is that short-term solution that's going to help a water system maintain access to safe drinking water while that long-term solution may be implemented. This is for emergencies and for those longer construction periods. So again, how would you prioritize where we focus our funding resources? Similarly, question number 4 is asking you to again do that budgeting exercise. You know, what percentage of funding would you allocate towards each of those solutions? So maybe up here you put you know, maybe emergency assistance at the top. Well, how much would you allocate towards that? Are you thinking, you know, while it may be the top priority, is it the only 10% of funding, or are you suggesting even more? So this is going to help us better understand how you're prioritizing these different types of solutions and services, and then the funding amount allocated to them. And then question number 5 is really if you have any additional comments, suggestions, ideas, really not captured in these questions. Obviously, hopefully you understand that what we're trying to get a sense for from you all is we only have a certain amount of funding and resources available to us. How do we prioritize where we try to target those resources within a fiscal year? If you have suggestions on things that we should be thinking about, we want to hear from you here. And of course, you can always send us your thoughts after today's exercise. This is not the only time that you can provide this feedback to us. Are there any questions? Because if not, I'm going to stop talking so you can spend some time with this survey.
Any questions on just how to navigate your cursor for the different questions? Any questions about the questions and the proposed, the options for responses? Okay, there's a raised hand.
From Isabel.
Isabel.
Sí,
Isabel,
estoy tratando de buscar en mi correo electrónico ese cuestionario. No sé si tengo mi problema hoy con mi ojo, estoy batallando mucho. Pero si me lo pueden reenviar porque yo sí quisiera contestar ese cuestionario, por favor.
Sí, señora Isabel, el cuestionario está en el QR code que está en el chat. Y también incluimos el link en el chat. Señor Pérez, ¿tiene alguna pregunta?
Sí, pues lo estoy viendo en... Sí, la pregunta sería que se puede llenar, tiene que llenarse ahorita o más después. Y casi es igual lo mismo, ¿verdad? ¿Se escucha?
Sí, sí se puede llenar.
Sorry, Marina, were you going to say we prefer now, but later it's another option if they feel like they need more time.
Sí, gracias.
Okay, if you can all, as soon as you're done completing the form, can you use the thumbs up to let us know that you're completed the form, please? That would be really helpful for us. Okay, Eva, Edwin.
Michael here.
Looks like we've got 7 responses so far.
Okay.
I'm having a problem sliding the questionnaire up.
I'm sorry, I didn't.
Michael here.
Could you repeat your question, Mr. Prado?
I'm having a problem scrolling the questionnaire up.
You're having a problem scrolling?
Scrolling it up. I'm at the top. problem 1. And it won't allow me to go any further.
Okay. So if we're not able to, can you try the feature on the side in your cursor to roll it to scroll down?
Nothing.
Okay, so what we can do, again, we can work with you to submit it after the meeting. Maybe perhaps after we're done, we can work with you to get that completed today. Would that work for you?
Well, I have a meeting after this one, but it's not going to take too long. We can go ahead and.
Yeah, it shouldn't, but if not, we can work out another day that we can do that. Okay.
Yeah, because it's my CSD meeting, the monthly one.
Okay, very good.
Thank you, Mariana.
Yeah, you're very welcome.
Mr. Prado, were you trying to do that on your phone or on your computer?
Laptop.
Laptop, okay.
I mean iPad.
Where is it?
On the iPad.
Where is it?
Okay.
Arena, we have
This is Rob Burrows. I'm having the
same problem.
Okay.
Are you on an iPad as well or tablet?
I'm on a
Sorry, you didn't hear that?
Yeah.
Could you repeat, please?
top.
Hmm.
Can you hear me?
Yes. I would maybe suggest just trying to refresh. You should be able to scroll in your web browser on the right-hand side to navigate through the survey. It's all on one web page.
I can't scroll on the right side. It won't let me.
Hmm.
I'm not sure what the problem is.
Could you try refreshing the URL, the web page?
I'm glad I'm not the only one, Rob.
Yeah, it's kind of frustrating.
Hmm.
Were we supposed to go someplace else other than the screen we're looking at right now?
Are you looking at the Zoom screen?
I am.
Yes, you should be clicking on a hyperlink to open up a web browser page to go to the survey. The hyperlink is in the
I
chat.
apologize. I didn't.
That's okay.
In the chat.
Mm-hmm.
There's a link and there's also a QR code.
You
Kristen,
referring to earlier?
how many responses have we received?
10.
10. Okay. And we have 16 participants.
I do wonder if Michael's also looking at the Zoom. So I'm going to stop sharing. And
this is showing up in Spanish.
Yeah, I'm wondering if perhaps the Spanish presenter, there we go. So if you don't see the
Michael here, excuse me. When I started out, it was on a whole different page. And I submitted the other page, and then I was listening to you, what you were going over, and I'm like, well, this is different than what I'm seeing. So then when I finished submitting the other ones I answered, then this one popped up that we're on now. So mine started like backwards. I went to part 2 instead of part 1. If that makes sense. Because then asked, which is a favorite time of the year, 1 through, winter, spring, fall. summer and all that and put them in the category, one being the best and so on and so forth.
That was the practice.
That was a practice one.
Well, I had a lot of practice and I can't even get started now.
In the Zoom window, Michael, are you able to go to the chat?
You want me to start all over from point one?
Yeah, the first
Okay.
question, the first question you should see is arrange the community types by.
Yeah, okay, hold on.
Okay, Kristen, how do you want to move forward with this? Do you want to just continue with the responses we've received for now and work with the remaining folks who are having technical difficulties with it?
Mm-hmm. Yep.
Yep. Okay.
For my screen again. Can you see it? Let's see. All right. So we have 11 submitted responses. If you're still working on yours, don't worry. We'll still get your data.
Absolutely.
I'm gonna.
Okay, Michael here. Excuse me.
Hi,
I
Michael.
went back like you said, start all over. Now I'm able to scroll through it.
Perfect.
So you want me to go ahead and get started on it?
Please do. Your feedback is valuable. Thank you.
Thank you. Thank you.
So you'll see if anyone submits their data while we're looking at this, it's automatically going to update and refresh. Okay. So we're looking at question number 1. And this was ranking the different community or system types in the priority order from highest to lowest. And it looks like the majority of folks put failing public water systems at the top, with over 73% of respondents selecting that as the option. And I'm realizing I'm a little zoomed out here. Let me zoom in just in case people. There we go. And then domestic wells are listed as number 2. So you can see pretty big jump though between number 1 and 2. And it looks like there's a bit of a tie, if you will, for 3, 4, 5. We have at-risk public water systems, state smalls, and tribal communities kind of ranking fairly even. And then not at-risk public water systems are the lowest ranked priority community and system type. Does this surprise anybody? I'm guessing not, since the data looks pretty consistent here. This is super helpful. Thank you. So the way that the Microsoft Forms displays the results of the percentage ranking can be a little bit challenging to understand. So I'm going to walk you all through this. So it shows the max and min values that respondents selected, and the kind of bigger the color of a single color, the more people that selected it. So it looks like most people put the higher percentage of funding going towards our failing water systems. So we have at the highest, we had a handful of folks select over 60% or 50 to 60%. About 33% of you guys selected the 30% category as the lowest. But you can see here, definitely that the highest priority group for funding, highest percentage, was our failing public water systems, which then aligns with the data that you guys provided before. So that makes sense. We can see a pretty even split then between all of the other systems. For at-risk public water systems, a few folks said 0. And let's see. And then we've got the highest percentage is 30%. So anywhere between 0 to 30% for at-risk systems. For not at risk systems, the vast majority of you guys said 0%. Don't give not at risk systems. Don't give them any safer dollars. Don't prioritize them for safer. Which again aligns with what we see up here with, you know, putting not at risk public water systems at the bottom. Don't give them much money or prioritize them. Then for state small water systems, the spread is between 10 to 30%, but most of you are saying no more than 10 to 20%. Now this one is interesting though, domestic wells. So if you guys remember up here, a lot of you put domestic wells as the second priority for safer assistance. But for domestic wells, the dollar spread here is quite dramatically different. We have half of you said 10% of funding, all the way up to 50% of the funding. So that's a really interesting spread. It looks like the majority of you said 20%. So the way that I would interpret this is that failing water systems are highest priority, followed by domestic wells. But the majority of the funding should really be going to those failing public water systems and very little going to the rest, including domestic wells, which is ranked number 2. So that's how I interpret that data. So I thought that's pretty interesting. And then tribal water systems, we have a spread between 0% and 20%, but most of you are saying 10%. Okay. Let's see, for number 3, and you can see it refreshing as more data comes in. Now we have 13 responses. Arrange the solution types by highest priority to lowest priority to receive safer assistance. So this is, you know, where would you be spending your money on, like what type of solutions? And we have construction, including consolidation, is ranked number 1, around 30%, I think here. Yeah, so pretty cool. Construction at the top, then technical assistance, followed by interim assistance, O&M, planning, and then administrator assistance at the bottom. And here too, we're seeing a good chunk of folks are suggesting a much higher percentage of the funding be allocated towards construction or consolidation, and much lower percentages of the funding going towards planning, technical assistance, and everything else. Although I do see much more of a spread on emergency assistance than the other categories. And yeah, that's the results. And again, feel free to modify your results or to email us with additional suggestions. And we appreciate you experimenting with us, a new way to collect your feedback today. I know some of you struggled with the form. We apologize, but it's really useful information and we appreciate it. Marina?
Yeah, thanks, Kristen. I just wanted to make a point that we should only be, we only have 14 members participating in today's meeting. So we're just missing one response. So we'll make sure to follow up with that member to make sure that they respond, provide their feedback on this. Again, thank you very much for allowing us to try something new with you, just a different way of soliciting information and valuable feedback from you. So at this point, we're going to open up to see if you have any questions for Kristen on the questions or some clarifying questions, or perhaps actually if we can pull this form back up, there were some comments that were shared. Do we want to maybe read those comments? If you can scroll down, please. So
yep. So we have, it would be great to see some funds going towards regionalization, especially in rural areas where a number of systems could share services. Another respondent said, believe there remains a space where point of entry, point of use, which is decentralized treatment, may serve as a solution for small and private well situations. This may be covered under the interim water supplies and emergency. However, I wanted to formally call this approach out. It's a possible opportunity. Absolutely. A longer comment, domestic well consolidation projects need to be prioritized. Safer program priority identifies accelerating consolidations for failing and at-risk systems, including state smalls and domestic wells near community water system boundaries, and promote regional scale consolidations. We found this not to be the case, as too few domestic well projects have been developed, and there has been pushback on the increased costs associated with domestic well consolidation projects. These projects are costly and also provide significant resilience to very vulnerable communities. Comment 4, it's not clear to me whether SAFER funds can be used for tribal water systems, given that regulated water systems are subject to EPA's jurisdiction. When SAFER was first established, it was for operations and maintenance activities, as existing grant funding was only for capital projects. For example, if a water treatment plant was built using state grants, the water system may not have the expertise to operate the treatment plant. Small water systems are not sustainable, and our focus must be reducing the absolute number of utilities that are operating in the state. Number 5, I put planning as 0, assuming based on this year's numbers, there is other funding available for that. Administrators and direct operational maintenance, I put as at 10%, given both they both serve small numbers of systems. Doesn't necessarily reflect their importance, but given the small numbers, neither should go over 10%. Even though I put it as 10%, I think O&M is super important and a top priority. For question number 1, I put tribal water systems first, assuming that it meant failing tribal water systems. And that's what it did mean. Mm-hmm. Marina, you want to help with the Spanish?
I'll have the interpreter go ahead and come on. Mark or Andres?
Yes. Yes, thank you. You could have read 8 too. You did a great job. Yeah, all great. This is super helpful. And again, if you have any additional thoughts or comments, please don't hesitate to share them with us. We want to hear from you. It's the point of this group. Okay. I forgot you could present these.
Mm-hmm.
I think it's pretty similar to what we saw before. Okay. Marina, anything else?
No, just wanted to see if there's any follow-up questions from the group before we take a brief break. We'll just take maybe 2 to 3 questions. Okay. Looks like there's no takers, so we're going to go ahead and there's one raised hand. Go ahead, Eric.
I was wondering if there's a space to provide additional comments in response to the fund expenditure plan and the strat's priorities outside of the comments we shared just now.
So yeah, so you can always email the team with your comments. At the end of the MS form, there is also a section for comments, so that would also been an opportunity for you to put other comments. But we're always, looking forward to receiving your feedback via email. Okay, cool. All right, any other questions? If so, please raise your hand. All right, so we're going to take a 5-minute break. So if you can please return by 2 o'clock, that would be really helpful. This will be the last portion of the meeting, so I would appreciate if everybody can just come back on time. So please return by 2 p.m. Thank you. Okay, folks, it's 2 o'clock. Thank you for those who have made it back on time. We're just switching out our PowerPoint presentation slides, making sure that the right version is being shared with the appropriate webcast. So give us a few more minutes on this, and we will continue with the meeting. Apologies for the delay. We're still trying to adjust the PowerPoint slides. Michael Ben, can you advance the slide, please, to remove it from pausa? Apologies again. We are experiencing some challenges with the PowerPoint. We appreciate your patience in this. We should be up and going shortly. Okay. Okay. Apparently, we're having some challenges showing the correct PowerPoint on the correct webcast. So on the English side, we're seeing the Spanish content, and I'm not sure what the Spanish webcast is showing. So again, we're trying to sort that out. Okay.
Marina, I'm not sure what the issue is, but I'm able to see the presentation in English. I can toggle between the two.
In the English?
Yes.
If you're on the English one? Okay. Okay, let's okay, so team, I'm referring to the SAFER team. Let's go ahead and get started. Thank you, Anthony, for announcing that. I wasn't able to see that on my end, but thank you so much. Okay, we're going to go ahead and get started. Again, thank you for your flexibility with this. So next slide, please. Great. So at this point, first of all, welcome back. And again, thanks for bearing with us today. We wanted to start off this last part of the meeting with a few highlights and updates that you would have found in your meeting materials packet. So the first update, thank you, Rachel. So the first the update that I want to share is a really important one. On April 17th of this year, the State Water Board added a new standard for public health protection to California's drinking water by adopting a maximum contaminant level of 10 parts per billion for hexavalent chromium as a single constituent. So the new MCL will reduce affected Californians' potential exposure to hexavalent chromium to 1/5 of the current regulatory level. Board staff proposed the following implementation schedule range for the MCL treatment. In 2 years for systems with over 10,000 service connections, 4 years for systems with under 1,000 connections. Also, the board works very closely with small water systems through the Safer Drinking Water Program, providing funding and technical assistance to help serve safe and affordable drinking water. Projects that will help systems comply with primary MCLs or standards based on health impacts, such as the MCL for hexavalent chromium, which are eligible for financial and technical support. The new MCL must be finalized by the Office of Administrative Law before going into effect, which is expected to be by October 1st of 2024. Next slide, please. So also that we have the tentative safer timeline for 2024 is as follows. In June, which is already next month, we will have the draft fund expenditure plan released for public comment. In July, we will have the start of the Safer Advisory Group application process that will start all over again. It feels like we just did that. And additionally, the third advisory group meeting will be on July 11th. So just a note, the original date was scheduled to be in August. We had to move it up. So please make a note of that. The advisory group meeting number 3 is scheduled for July 11th. Also, the end of July will complete the public comment period for the fund expenditure plan. So please note that. As I mentioned earlier, the Safer Advisory Group application process starts July 1st. And it will conclude on August 31st. So just a reminder for folks that are our current advisory group members, if your term is up and you'd like to continue, it's important that you reapply to continue on past your deadline, past your term, sorry. Yeah. Also, in the fall, the board will be considering adoption of the fiscal year 2024-25 fund expenditure plan. And the last advisory group meeting for this year will take place on December 5th. Please note that the dates mentioned here are subject to change. So just make sure that we make sure that we're aware of that. And also it's really important for you to check your emails for any communications that come from Caroline regarding any changes in dates and whatnot. Okay, next slide, please. Next slide, please. Okay, so now we're going to transition to advisory group member announcements. Next slide, please. So now we invite advisory group members to share their work in 2 minutes or less, that particularly focusing on any involvement with drinking water projects under the SAFER program. We thank you for sharing announcements in advance. And we want to make sure that you speak again, clearly and slowly so that we can be able to interpret your comments. So are there any members that would like to share an announcement? If you can, please raise your hand. If you want to make an announcement, please raise your hand. And we'll call you in the order that the raised hands received. Sorry, I'm scrolling. Okay, Shannon. You have your raised hand?
Yes.
Go ahead.
Actually, I've been working with Stantec pretty extensively. I know that Stantec's been working as one of the agencies with SAFER on some of the initiatives. And for example, hex chrome as a California standard that is not in the NSF standards for product certification. So with them, we're working on a couple of initiatives with the NSF standards, looking to add in hex chrome. We were successful with getting 123 TCP added into the NSF standards recently, so that is available. But we're also working on education for small systems, and so I've been working with them alongside with our Water Quality Association to expand education for operators. It's been a pretty big project. We have some meetings actually next week in Ann Arbor, Michigan, to go over updates to the NSF standards and specific to PFAS as well with the new regulations that have just been adopted.
That's great. Thank you, Shannon, for sharing, for providing this announcement. Okay. Chad, go ahead. Chad Fisher.
Oh, I was just doing the clap sign because I know I work there, and it's anyway. Bravo.
Well, thank you for the clap and the kudos. Yeah, absolutely. Okay, sorry, folks. I'm scrolling. There's a here we go. Next comment is Eric. I'm scrolling just for hands. Eric, go ahead. You have an announcement to make.
Well, I don't have a ton of like date updates, but Community Water Center continues to work on projects in the communities of East Rosie, West Goshen, and a couple of other projects on the Central Coast as well, where we're outreaching to community members and talking to folks about their drinking water supplies. So those are a number of the projects that we're working on. I also wanted to plug in a webinar that Community Water Center is hosting next week. I'll drop I can drop the registration link in the chat, but the title or the subject is America's Drinking Water Affordability Crisis and how to solve it. And there's going to be some folks from across the country just talking about the issue of affordability.
That's great. Yeah. Yeah, if you can put that in the chat, that would be great. Thank you. Thank you, Eric. Okay, Stephanie, you're up.
Thank you. So in the Chowchilla Subbasin in Madera County, we have a domestic well mitigation program that we started about a year ago. This will allow SAFER to sort of back off some of the funding slowly that's going to self-help for providing emergency services, as well as longer term solutions. So I'm not sure everyone's aware of that, but that's in the Chowchilla Subbasin. And then in the Madera Subbasin, we have a grant through DWR SB 552 funds to do something similar with some facilitation services. So we'll be starting that shortly. Thank you.
That's great. Thank you, Stephanie. Okay, next up is Kristen.
Yeah, I thought I would just share that I, along with several colleagues and with the help of a lot of technical assistance providers, have just concluded putting out a survey of water system consolidation projects. So we sent surveys to all the consolidation projects that are in progress or completed, and we got more than 80 responses, which was actually better than we were hoping for, which is really exciting. So in the coming months, we'll be analyzing that data and hopefully have more information to share about common challenges and successes amongst consolidation projects, as well as more information about what the outcomes of consolidation has been in completed projects. So yeah, we look forward to sharing that in the coming, hopefully this summer we'll be able to put out the results of that survey. And then the next steps moving forward will be to do some deeper dives into those results with case studies. And so for those who are involved with consolidation projects or have them in their area, definitely if you see kind of as we put out the results, we'll be looking for kind of ways to carry forward, going deeper with those results with specific case studies. So just put that on people's radars. If you have ideas, you can be in touch.
Kristen, that sounds really exciting. Be curious to see what that looks like.
I am too. I haven't gotten to look at the data yet,
cool.
but soon.
Yeah. So are just out of curiosity, the surveys were all done in multiple languages, or
So the surveys were done in
mhm.
English to water system. So
Oh,
it's
gotcha.
to the water system board or general manager. So
Mhm.
we had board members. I'll out you, Michael Prado, because I know you were okay with it, but Mr. Prado Senior participated, others participated. So board members and general managers mostly from the water systems. And another tangential project we would like to do would be to talk to residents, particularly domestic well residents, about their experience consolidating onto systems. But this specific survey was focused on the water system managers themselves.
Got it. Okay, cool. All right. Okay. Any other announcements of any of the members would like to make? This is your opportunity. Okay, I don't see any raised hands. Okay. All right. Okay, one more hand. I'm not sure who raised it.
Michael.
Mike, okay, sorry. Go ahead, Mr. Prado.
Hi, Michael here. I just wanted to reach out. I'm a member also of the Irwin Regional Board, Advisory Board, and the Irwin organization handles a lot and does a lot of projects throughout the central San Joaquin Valley, and they're in need of funding. So if SAFER would be able to support that, to be able to keep Irwin Regional organization going, so we can continue helping people. Thank you.
Thank you, Mr. Prado. Okay, any other, two more hands going up. Isabel, followed by Chad.
Sí, yo nada más lo que les quiero compartir que nuestra comunidad seguimos trabajando para haciéndose el estudio sobre consolidación con la comunidad más cercana. Igual vamos a necesitar mucho del apoyo de los miembros del agua, porque para ir quitando esas barreras y llegar a un punto medio donde es lo mejor para nuestras comunidades. Además, está haciendo el estudio también sobre el drenaje, y que sería algo muy, pero muy favorable para nuestra comunidad, debido a que la comunidad cercana tiene sistema de drenaje, y también vamos a ocupar de los fondos para que se nos apoye y este proyecto se lleve a cabo, del consolidar lo que es el drenaje y el agua potable. Eso ayudaría fantástico a las dos comunidades, a ellos a que crezcan y los costos bajen, y solucionar de una vez por todas el problema tan enorme, lo que es la contaminación con los pozos sépticos. Muchas gracias.
Gracias, Isabel. Chad, you have your hand up. Do you want to make a comment or ask a question?
I did. Thank you, Marina. I was just going to make a comment based on what Mr. Prado mentioned about earweb. Next Wednesday, there's the work group meeting, and I just wanted to say that I'm presenting and going to participate in that earweb work group meeting to increase synergy between SAFER and those efforts. So I think Mr. Prado participates there, so I may see you next week, Mr. Prado, and maybe others on this call. So, yep.
You'll see a few familiar faces.
I'm sure, but just wanted to mention that to the group that won't be there or just wasn't as familiar. So, thanks, Marina.
Yeah, thank you, Chad. Of course.
Marina, if I may.
Yes, sir. Of course.
Chad, thank you, and I'm the reason you're there. I told him.
I knew it.
Thank you.
I appreciate you.
All right. Remember, it takes teamwork.
That's right.
Teamwork. I appreciate you greasing those skids and allowing me to be there. So, yes.
Absolutely. That's what it's going to take. It's going to take all of us working together to get to these solutions. All right. Jim has raised his hand. Jim, would you like to make an announcement?
Yeah, I'd just like to ask a question. What is the AirWeb or AirWeb? I'm not familiar with that group. Oh, does anybody, Mr. Prado or
Chad?
Yeah, Chad.
Do you want to respond?
Yeah, sure. The earwimp, I may get the acronym wrong. It's DWR funding, the Integrated Regional Water Management Program. I'm not sure. Is that, I'm getting a little bit of a nod. I think that's right. Okay. Yeah.
Eric just put some information in the chat. Thanks, Eric.
Perfect. Yeah.
Thank you.
It's been a funding stream from DWR, a little different than, traditionally a little different than state board and safer funding, but oftentimes there's opportunities for synergy and
okay. So just another, it is another tool though, in addition to safer.
It is another tool. Yeah, with I'm not an expert, but with different funding guidelines and different kind of application processes and whatnot, but certainly a resource.
Okay, great.
Hey.
Thank you.
It really kind of
Thanks,
looks
Jim.
at things at a more watershed level, Jim. It's looking at like integrated watershed management rather than drinking water per se. Sometimes there will be drinking water projects that might improve drinking water conditions or water quality. They're meant to be multi-benefit usually, but I believe they're still using Prop 1 money from, I don't know, 10, 15 years ago. And so the guidelines are quite a bit different than how SAFER is set up.
Oh, I see. So there's a water quality improvement component to it for watersheds as well as a requirement.
It's competitive based, so you can apply for projects based on what your local group wants to propose on, and then they're ranked and scored, and DWR awards the money. So if you had a water quality component, it may rank higher, it may not.
Okay, great. Thanks a lot. I'll look into it.
All right. Great announcements. Good resource sharing. Awesome. Okay. Any additional hands? If not, we're going to go ahead and move on to public comment. Okay. So at this point, we're going to move. We want to first of all say that, thank you for your announcements. Our team has documented your updates in the meeting notes, and they'll be available for your review in the next few weeks. Next slide, please. Cool. So we're not going to open the meeting for public comments. Public comments can be submitted in person through Zoom or email to safer@waterboards.ca.gov. Next slide, please. So here are some public comment guidelines. If you are in person, we ask that you raise your hand, wait to be called on, and speak slowly and limit your comment to 3 minutes. If you're participating remotely, we ask you to email your comment to safer@waterboards.ca.gov. You can follow the instructions in the return email to join Zoom if you want to verbalize your comment, and wait to be called on. Again, speaking time is limited to 3 minutes. And if you experience any type of technical issues or need language assistance, you can email us at safer@waterboards.ca.gov. Next slide, please. Oops, go back. Sorry. I thought there was another slide. Can you go back one slide? Thank you. Okay, so we've checked with our in-person support who is in the coastal hearing room to see if there's anybody that has been physically present to provide public comments. Michael Ben Ortiz, and he's indicated that there is no commenters or people in attendance in the hearing room at the moment. So at this moment, we're going to go ahead and take some of the public comments, and I believe that there is an individual who is in the waiting room, Angela Islas, who is waiting to make a public comment. And so I will work with, rely on Caroline to allow her in. So whenever you're ready, Angela.
Hi.
Hello.
Can you hear me?
Yes, we can hear you just fine. Thanks. And see you
Hi.
too.
Sorry. The live stream is kind of off with like the actual link, so I got myself confused. Sorry.
No worries.
Yes, so good afternoon, everyone, AG members. My name is Angela Islas. I am a water projects coordinator at Central California Environmental Justice Network. That's CCJN for short. We're here in the San Joaquin Valley region. And the item I'm going to be covering is going to be item 2 on the draft priorities list for the funding expenditure plan. I do appreciate just the amount of work that the staff has developed and also has been working with the AG for the funding priorities list. I do want to just kind of keep it short with my comments regarding the domestic well program and just kind of elevating some of the concerns that your member Isabel Solorio had mentioned. I think that with some of the work that my organization has been doing on the ground, supporting domestic well owners in the Fresno County area, most in particular, we've been pretty much noticing some concerns around eligibility criteria. Again, I think that, you know, there's a struggle with a lot of domestic well owners with their medium household income, barely scratching the surface with some of the program's eligibility criteria. So elevating sort of that concern is something that I wanted to make sure that was brought to the attention of the AG members and even also the staff and SAFER, just trying to figure out what is an appropriate, threshold, especially for households to be able to qualify, because again, some of the residents that we've worked with have had some of these obstacles with not being able to qualify for the loan or even an application to be able to receive funds just because of their medium household income barely scratching the surface. So again, wanted to elevate that concern overall. But I do also want to mention as well that in the development of some of the mitigation plans that I'm observing, eligibility criteria also has some gaps with sort of the qualification of a well. So I've noticed that there's been issues with the age of a well and even the operation of a domestic well not being qualified or sufficient criteria to be able to have a resident have access to the mitigation program. Again, this is just an observation that I'm seeing, and I think it's important to elevate it at the SAFER level to understand, you know, what can be done to remediate those kinds of operations, especially that if a criteria is making the age of a well ineligible criteria, I think that's just something that may need to be kind of elevated in terms of what can SAFER funds do to support that kind of investment, or even if other programs can allow that support as well. So that's just all I wanted to just elevate at this level. Again, I'm looking forward to just still following the process of draft priorities and just looking forward to, you know, exploring still some of the options to ensure that these programs are available for everyone to have safe drinking water. So thank you so much for your time.
Thank you, Angela, for your time and for sharing your comments. And we encourage you to keep participating in these meetings. Much appreciated. Okay. That is the only public comment that we've received thus far. So I believe there's a question from Edwin. Edwin, do you want to ask a question?
On what she brought up, can I get some information on what is that medium income requirement? And then what are we involved in deciding that? I don't even know if we are, but I would like to, if we can, help people. But yeah, just some information. I'd appreciate it. Thank you.
Thank you. I'll defer that question to our team members from DDW.
I can try to chime in too.
Thanks, Jeff.
Yeah. So for the regional domestic well programs, those are aimed at assisting disadvantaged communities or low-income households. And that way that's defined is 80% of the median household income for California, which is it changes ever so slightly year after year. I think the newest numbers put that somewhere around $70,000 per year. So if they're above that, they're considered, or they're below that, they're considered a low-income household or a disadvantaged community.
Thanks, Jeff. Okay, hopefully that answered your question, Edwin. Okay.
But just to quickly follow up on that, the second part of my question, are we able to influence any of that?
Well, some of our funding sources have statutory requirements that's where the funds go to. And then largely in our plans and policies, like the fund expenditure plan, we do call that out as a priority for the funds to go to.
Because I mean, 70,000 to fix a well. I don't know if I make around that much. That'd be hard for me to fix a well, and I make a little more than that. So, okay.
Yeah, I think that's a valid concern too. We hear that quite frequently. That I think what Angela was saying is that they're barely scratching the surface, so they're just over that, and that kind of creates a challenging situation.
Yeah, I think fixing a well anywhere around that price code would kind of break me in terms of funding. It would be hard. So I don't think I'm above the medium too much, or at least I don't feel that way. That's all I have to say.
Yeah.
Thank you.
No, thank you for your question. Appreciate it. Okay. Looks like there aren't any more public comments that have come in. So we're going to go ahead and transition to the next part. And that's basically our closing remarks and next steps. So next slide, please. Okay, so as a recap of our last meeting, the SAFER advisory group, the SAFER team provided the following to the SAFER advisory group members. We provided videos in Spanish concerning the SAFER, it was the videos, the Water Board's one-on-one videos that we used at our onboarding session. And so as a request from some of the advisory group members, who had showed interest in having them dubbed to Spanish, we followed up with that and provided the dubbing and made them available. And Caroline's she'll be putting that link into the chat. They're available I believe they were sent to the advisory group members as soon as they were done. So just wanted to make a note of that. Additionally, the 2024 advisory group meeting calendar was also finalized and updated till now. I mean, it's current till now. So again, please note that those dates may be subject to change. Additionally, during the onboarding session, there was a question about whether Form 700, which is regarding the conflict of interest, needed to be completed by the SAFER advisory group members or not. And our attorneys have determined that they do not need to be completed by SAFER advisory group members. So just wanted to follow up and close the loop on those 3 items that were brought up during SAFER advisory group meeting number 1. Just to let you know that we have, we have followed through on this. Next slide, please. Oh, go back. Sorry. I'm just advancing. Go back. Thank you. The other thing is that we also wanted to, before we get going, we wanted to conduct a meeting evaluation. So Caroline, are you ready to start the poll? Okay, so on your screen, you're going to see a poll with the different questions in both English and Spanish. And if you can just be so kind as to just answer them. And we'll get a quick assessment of how our meeting went today. So these questions help us improve our meeting, so your responses would be much appreciated. The first question is, how satisfied are you with today's meeting? You can either rank very satisfied, satisfied, somewhat satisfied, or not satisfied. The second question is, which of the following statements do you agree with? And you can choose all that apply. There's a few different ones. I understand the topics we discussed today. I felt comfortable participating in this meeting. This meeting was a good use of my time. The meeting shared useful information, or the meeting materials were easy to read and understandable. Third question was, where can we make improvements? And again, check all that apply. None, the meeting was perfect. Presentations by water board staff, meeting logistic and Zoom issues, communication before the meeting, agenda and flow of the meeting materials, or other. And you can leave comments on the following question, number 4. So number 4, anything else you'd like to share with State Water Board staff? So those are the questions, so it should take you that long to respond. Looks like we've got 9 responses. Okay. Okay, looks like we've got 12 members. So we've got 12 responses. So we're going to go ahead and end the poll. I'll ask my team if it's good to end the poll. I think there's 3 more. Okay, there's actually 16. Okay, so it looks like we can if my team can tell me to clear the poll. Okay, we're going to end the poll now. Thank you everybody for your comments.
Yes, we can.
Okay. So it looks like most folks were pretty satisfied with the meeting, considering were technical issues. I appreciate that. And it looks like most folks also understood the topics today and felt comfortable participating in the meeting. That is really critical to us, and we're always striving to improve that. At least half of you thought it was a good use of our time. Many of you thought we shared useful information, and more than half indicated that the meeting materials were easy to understand. Okay, so here's where the make improvements. Okay. So meeting logistic and Zoom issues, we definitely 44% indicated yes, we do need to improve on the Zoom, and that we're going to focus on that. It looks like I'm not sure what else to say on this for question 4. Sorry, I can't see past that, but your comments are definitely helpful, and we will make every effort to improve our meetings moving forward. So thank you for that. Okay. So I'm going to close that out. All right, so if we can move on to the next slide, please. So as we conclude this meeting, I wanted to inform you all that I will be transitioning outside of the State Water Board's Cali PA in general. But I want to thank you all for making this a very memorable experience for me. And also just thank you for all the efforts that you provide and you make to provide, to make the advisory group meeting just an incredible experience and a way to provide feedback to the State Water Board. So thank you for that. So with that being said, this concludes our second advisory group meeting of the year. Thank you all for participating in today's discussion and to all of you who provided comments and especially participating in the poll. And I also wanted to especially thank the State Water Board Safer team for organizing this meeting and always going an extra effort to complete that. So thank you for that. And then also for folks who do need support or want to submit the information from the MS forms, we'd be happy to talk to you and work with you on that. So thank you. Carolyn, did you need to want to make a comment? Caroline, did you need to make a comment? Yeah.
Yes. No,
yeah, go
thank
ahead.
you.
Sure. Sorry.
I just wanted to thank you for everything. Oh, it's funny. I have the interpretation in my ear, so
okay.
I will do that. But thank you so much for all you've done for those past year for us here, and we will miss you terribly.
Wow.
But
Thank
then
you.
I would like, because I know that there's some folks around here and wanted to say something to you too, so maybe I will let Chad say something. So thank you.
Oh, thanks. Sorry. Okay.
Are you here, Chad, just to provide a comment?
Oh, I was I'm happy that Marina was comfortable announcing her new endeavor. I just wanted to say, you've been so central to this advisory group effort, and I know that all current and past advisory group members certainly appreciate your facilitation and just you being you, Marina. So
Thanks.
thank you.
Thank you so much. I'm gonna miss you, Chad.
Yeah.
All right. Nice thoughts. Thank you. Okay. All right. Mr. Prado, you have your hand up. I'm not sure if that was a leftover, a question that wasn't asked or.
No, I just had to stop crying there for a little bit. But I want to thank you, Marina, for all your time and effort and for making it a point to attend our AWA meetings on and off. You're always welcome. The door's always open.
Gracias.
And congratulations on your next endeavor. I need to know where you're going, though.
I'm going to
If
the
you don't
department.
mind.
Yeah, no, not at all. I'm going to the Department of Social Services. I will be coordinating their language access program.
Okay.
So
well, good luck. I'm sure you're going to be a big asset to wherever you end up.
Thank you so much, sir. Thank you so much. Appreciate it. Thank you.
And one last thing I wanted to ask, is the application process over for the Safer Wastewater Working Group? Is that right?
I'm not familiar with that particular group.
Okay, I thought I'd gotten information on that from the water board, but
okay.
I never heard no more on it though.
Yeah, we can follow up with you to see what information we have. So
okay,
okay.
I appreciate it.
Could you repeat the name of the group again? The wastewater? Sorry.
It was doing Safer Advisory Wastewater Treatment Plant.
Okay.
Like we're working here with water, that one's strictly sewer.
Yeah. I'm not familiar with the information. I don't have that information on hand, but we can definitely follow up with you, Mr. Prado.
Thank you so much.
All right. Thank you. All right, folks. Thank you for the nice wishes. And it's a great way to close out this meeting. And I just wish you continued success. All right. This closes this meeting. Thank you.
Thank you.
Thank you.
Gracias, Marina. Gracias por todo, a todo el staff. que siempre son tan amables y nos tienen la paciencia debido a las diferencias que tenemos en el lenguaje y que toma tiempo, pero se les agradece de corazón tengan esa paciencia para ayudarnos. Gracias.
Gracias a
Claro
usted.
que sí, señora Isabel.
Gracias.
Gracias, Marina, de parte de Silverio, y que adelante, que tenga, le deseo lo mejor en su cambio.
Gracias, señor. Gracias, señor Pérez.
Hasta luego.
Hasta luego.
Hasta luego, señor.
Okay. Okay. So if we can stop recording and I guess officially close. I know folks have had a long
Hasta
day.
luego.
Hasta luego.
Bye.
Hasta
Bye.
luego. Bye bye.
Thank you.
Suerte.